2021 meeting of the Calvert County Board of Commissioners. At this time, I'd like to ask Commissioner Weems to do the invocation.
Thank you, Mr. President. Please bow our heads in reflection. Dear Lord, we ask you for all the good things that you've given us to continue. In this era of COVID-19, give us compassion and empathy for others, and always a sense of goodwill towards our neighbors. And these things we ask for to you. Amen.
Amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. So the next item is to approve the agenda. Are there any corrections or additions to the agenda?
Mr. President, I make a motion that we approve the agenda.
Second.
I have a motion and a second to approve the agenda. Any discussion? All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. Next, public service announcements. Dr. Polsky is in the building. Let me see. So I do have a couple I can go through while we're waiting on Dr. Polsky. The senior centers are reopening on May 3rd. So we're very happy that after a year of COVID closing that we're able to open up those centers again. We also want to pass along our condolences for Mr. John Jack Ward, a member of the Zoning Appeals Board, passed away last week suddenly. Mr. Ward was a great individual, a great member, gave a lot to his community, and he's going to be sorely missed. Yes, Commissioner Hutchins.
Mr. Ward served on not only the Board of Appeals, but the School Board Planning Commission, a long time involvement in the community and over many, many years. And his brother Joe and Judy still live here in the county.
Yep. Mr. Ward spent a lifetime of community service, so we a great Calvert County citizen that we're going to miss. And I also want to announce that 2021 farmers markets are opening up now, so you'll be able to get your fresh local produce. Go on the county website to tell you where they are and the times of operation. So we have Dr. Polsky with us now. Dr. Polsky, the floor is yours.
Good morning, gentlemen.
Good morning.
Farmers markets, a wonderful opportunity to eat healthy and support our local agriculture. Our case counts over the past week, unfortunately, have risen back up a little bit. We did have some incremental decrease the previous 2 weeks, and then this past week, I'm going to flip aside, primarily due to a rise in infections in children and teens, as well as adults 36 to 55. All the reduction we saw the previous 2 weeks, we saw the numbers go right back up, just a little bit above the previous baseline. So take a look at numbers. We're still seeing about 2,000 people each week getting tested. We had 151 confirmed positive cases with a positivity rate of 7.3%. When we take a look at deaths and hospitalizations, and these are statewide, which gives a better picture when you look at a small county, the numbers fluctuate a lot, that we're still seeing a significant number of deaths, so close to 100 deaths per week, or to put it in another term, we're seeing one Marylander die every 2 hours at this point, and that is in part because of the infection rate, in part because of the variants being more severe in terms of illness. And so locally in our hospital, we have people ranging from their mid-30s to their mid-80s hospitalized right now. We have a half dozen people inpatient at the moment. Fortunately, we are seeing a continued increase in the number of people locally and statewide who are getting vaccinated. The numbers up on this chart are a portion of the entire population, so it includes those under 16 who are not eligible for vaccination. If you take a look just at those who are eligible, Calvert County has now crossed the 50% threshold, so now 53% of those 18 and over have received at least one dose of the vaccine. We are now slightly trailing the state, and we've talked before that that is likely in large part because we were getting relatively small numbers of vaccine locally. This week, we are receiving, in conjunction with the hospital, a shipment of Pfizer vaccine that does two really important things. One, it increases the number of doses that we have locally, and the second is that now 16 and 17-year-olds can be vaccinated with Pfizer. So we've already begun discussions with the schools, and in particular sports teams, where we have seen a significant number of cases and outbreaks. We're also talking to rec leagues. Dr. Folsom is here with me today, and she has been doing yeoman's work, connecting not only with the schools and rec leagues, travel teams, and the high school teams, but also working with the Chamber of Commerce and Kathy Manny. And we've been working with various business sectors to try to increase the amount of vaccination taking place. When we take a look at 65 plus, I mentioned before that really we're doing a phenomenal job locally. Frederick County had slipped by us into second place last week, and then we have moved past Frederick back into second place again. So out of all the counties, despite not having the same number of doses that they're getting in other areas, 85% of seniors in Calvert County have now gotten at least one dose, and 75% have completed their vaccination series. Certainly our local hospitalization rates would look much worse if it hadn't been for this tremendous effort, and we're hoping that the remaining 15% of seniors will end up getting vaccinated pretty shortly. So taking a look at where people are getting vaccinated, you can see that the health department has provided the majority of the doses, but not to underscore the importance of both the hospital staff, local pharmacies, and then you can see outside of the county, getting into smaller numbers, we are starting to see a bit of an increase in people going over to Charles County to the mass vac site over at Regency Stadium, but still a relatively low number compared to the total. I do want to mention that the state just opened up another mass vac site in Anne Arundel at the Navy Stadium. So for people in the north part of the county, that might be reasonably accessible. But at the moment, we have, again, a greater supply in the county, and I'm not sure that as many people will need to leave the county over this next week or two to get vaccinated. So taking a look, again, at all the places across the county where people can get vaccinated, and I included this week some of the private medical providers who now have vaccine. I will say that they have a limited number each week. So for Calvert Internal, as an example, they're only getting 300 doses a week from the state. They have over 10,000 patients who have yet to be vaccinated. So for people who get their care at those providers, it may be feasible for you to get your vaccine at your doctor's office, but at this point, that's going to be very limited, so people should not delay. If they can't get their vaccine directly through their family doctor, then they should reach out to the health department, to county government, or to go to one of the mass vac sites or a local pharmacy. One thing that is new since we talked last, want to mention, I highlighted on there that now that we have a better supply of vaccine, we are making enrollment for vaccines immediate. There's no longer going to be the need to go on a registry. So if someone today wants to get a vaccine today, we are at our drive-through site, we're doing vaccinations. I highlighted that people can go to the website calvertcountycovid19.com. That's the health department's COVID-specific website. And you can register directly, pick a time, get your appointment, and then just drive over to the site and get vaccinated. We've also talked to our county government employees who have been really working very hard to help people get appointments. For those that do not have the ability to register online, that they can call the 410-535-0218 number, and county government staff will now help people enroll immediately. So again, no more getting on a registry and then waiting for someone to get back to you, that the county staff will be able to immediately schedule an appointment, and then that person can go ahead and get vaccinated. So I think both of these are a tremendous plus. We wish we could have done it earlier, but we just did not have the vaccine supply to allow that, and we're hoping we can continue this. Now, I will say today is the first day that we are putting this into action. So like anything that has to do with technology, hopefully it'll work smoothly, but there may be a few days of transition. So if anybody goes on the website, has some frustrations or problems, one of two things. Either call the number to have someone help them, or maybe give about an hour, go back on, and hopefully things will be working a little bit more smoothly. And I did want to just talk briefly about the Johnson & Johnson vaccine. I know that certainly has been in the news over the past 2 weeks. As most people know, the FDA put a temporary hold on the use of the Johnson & Johnson vaccine about 2 weeks ago because of a report of a small number of blood clots, but they were blood clots that were very serious and could potentially be life-threatening. And so they paused while they took a look and made sure they had all the evidence they needed before making a decision. The FDA met again on Friday, and at that point, after examining the evidence, decided that the safety of the vaccine was still extremely good, and clearly the benefit to the vaccine is there, and so they took the hold off, and the vaccine is available again. Now, in a little bit more nuanced way, so I'm going to speak as if I was counseling one of my patients, that all of the blood clots, which is a total nationwide of 8 million doses, with 15 blood clots, so less than 1 out of every 500,000 people vaccinated. Those blood clots all occurred in women, and 13 of the 15 occurred in women under age 50. So the concern is really if in the age group of women between ages 18 and 50. For those women over 50, the risk of a blood clot was less than 1 in a million, so they saw 2 blood clots in that entire group. So for men and for women over 50, I see no issue if someone chooses to get the Johnson & Johnson. The advantage there being it's a 1 dose. With the Moderna and Pfizer, it's 2. So for people who'd want to get a single dose, then I see absolutely zero issue for women over 50 and for men. For women under 50, I think it's a decision to make. And again, that risk of blood clot is very, very small. If you just look at that group, the risk of getting a blood clot is about 1 in 140,000. So still, we're talking very, very small. The risk of ending up with COVID, and let's take women in their 20s, statewide to this point, we've seen 39 deaths in people in their 20s. If you take a look just at women, the risk of dying from COVID to this point has been 1 in 20,000. So I think that most people just look at, for somebody that age, there's really no risk. The worst is you don't feel good. So the risk of dying from COVID is 1 in 20,000. The risk of getting a blood clot, not a fatal blood clot necessarily, but a serious blood clot, is 1 in 140,000. Or to put it another way, you're 7 times more likely to die from COVID if you're a woman in your 20s than you are to get a blood clot from that vaccine. With that having been said, the Moderna and Pfizer vaccines have shown no blood clots after we're up to about 400 million doses in this country. So if I was counseling my patient, I would say that if the Moderna or Pfizer is available and you're female and you're under 50, then that takes away that risk, and that would be my choice. For someone who, for personal reasons, would want to get a single dose, I think the risk, again, is so small of a blood clot that it is in someone's best interest to protect their health, protect the health of their family members, to go ahead and get Johnson & Johnson, regardless of age. And again, for women over 50 and men, I don't think there's really any issue, and it's just personal preference at that point. And I will remind, as I have every time, for anyone who is concerned because of rumors they hear on the internet or whatever personal concerns that they have, please speak to your personal health care provider, your physician, your nurse practitioner. I do not know of a single doctor or nurse practitioner in our county who says anything other than people should get vaccinated.
So, Doc, you remember last time we had a discussion of basically here we're having this global health crisis, but there's no narrative about being healthy. So I was reading, and I read this. I thought you found this curious. I'm sure you noticed. It says CDC study finds about 78% of the people hospitalized for COVID were overweight or obese. Why is that such a hard narrative to get out to people? Why isn't this country pushing, hey, look, the healthier you are, whether you get cancer or anything else, the healthier and the stronger your body is, the better shot you got.
Right.
But we're spending all this media focus on shot, 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 shot. Are we that lazy of a country that we just want something bottled up, that we don't have to worry about anything else that we do and how we take care of ourselves? I don't understand why there's not this push that, hey, here's another reason. Take care of yourself. eat the best you can, move a little bit at least. I don't understand where that's getting lost. I mean, all that you turn on TV is for is, hey, all I need to worry about is getting a shot and it takes care of everything in life. And I just don't think it's that simple.
Well, certainly both are important. And in the short term, if someone is 50, 60 pounds overweight, they're not going to lose enough weight to reduce their risk for the problem we're dealing with right now for COVID, because they could end up getting infected a month from now. For the long term, both to reduce risk of infectious disease, and it's not just COVID.
Sure, I
flu,
think high blood pressure, diabetes, all these other
and,
things.
right, we look at cancer risks and all the things that people know. And one of the pushes through the health department that we made back last spring and summer is that we knew that when fall, winter rolled around, we would see an increase in cases. Really work with your patients who are diabetic, have blood pressure problems, get things under the best control you can now before we get into fall and winter. But we also know how difficult it is for people in this country to start to move their health in a better direction. And it was prior to COVID. You know,
Sure, it's been an ongoing problem. I remember so many administrations have had, remember they used to bring Schwarzenegger in to talk to the country about lifting weights. But this is a perfect opportunity, a perfect venue. The money is being spent, the trillions of dollars being spent. Why are we not starting programs off in school about eating right and nutritional value and mandatory physical movement? That's just as important as learning something else. I mean, if your body's no good, I just don't understand where that discussion is. It's the perfect venue for me, I would think, to get that going.
And the health department and the hospital, we are working with primary care providers, with diabetes initiatives, get more people into, and it does take education. We live in a society where there is a clear financial incentive by a lot of corporations to sell you stuff that is not good for you, is going to end up making you unhealthy in lots of different ways. And of course, I'll pull my phone out. I mean, how many people just, when you're sitting there like this, you're not out exercising,
Right,
you're not out
right.
there, being active.
And you know yourself, Doc, there's not a person walking the earth hasn't heard of COVID now. Not a person.
Right.
But how many people truly know how to eat right and know how much exercise is needed? I mean, all these things. No talk of that. It's just, well, go get a shot and go back to eating 20 cheeseburgers and sitting on the couch and you'll be okay.
Well, I hope that's not the message.
But I mean, it just, we just live in this just 2-second society where, well, I know it's a little inconvenient, but make sure you pull up and get that, and then you go right back to normal. Instead of the building blocks, when I was a kid, there was tests in school. How many push-ups? How many pull-ups? And now seems like it's offensive to say, hey, there's nothing wrong with trying to get people as healthy as possible. There is nothing wrong with that. But that's lost in the whole thing. It's all we're hearing is these big major companies are coming to the rescue. How about putting some salad mix, on the thing? You know what I mean? So, a treadmill, anything. I mean, my God, is it that much to ask with the trillions of dollars to not take just a small percentage to start educating people? Hey, okay, we're dealing with this today, but what's coming tomorrow? And for whatever's coming tomorrow, be as healthy as possible so that help your body help you.
Right.
I just don't get it.
I agree with you 100%. And public health has been arguing for years that we are starved for funding. You can't make money off of helping people be healthy.
You couldn't have got $3 2 years ago for something like that. Now you wave the COVID flag and the checkbook comes.
Well, and I have been pleading both at state level and federal level that we end up with sustainable money, that we can do things just like what you're talking about.
Right, because you can't just do it today.
Right, we get a flood of money just to deal with COVID, and then a year from now, everything evaporates and we're right back where we were before.
Exactly.
Yeah.
I think I just realized today that Commissioner Hart is the Dr. Oz of Calvert County.
So
You done, Commissioner Hart?
Oh, yes, sir. Yes.
Okay. The drive-through, is it open every day during the week now, or what?
It will be contingent on the doses we get. So we still don't have enough doses to have it open every day.
Right.
And we also do second doses some days. So this week, the drive-through is open 4 days out of the week. That's the most we have right now. And honestly, we're reserving some because we're working with the schools. You probably have heard that University of Maryland and a lot of private colleges are now going to mandate vaccination before anybody can walk on campus coming this fall. So we want to make sure, because the Pfizer doses are the only ones for the 17-year-olds who are going to be going to college. Those are the only ones that are approved. We want to make sure that, because this may be the last batch of Pfizer we get for who knows how long, we want to make sure that we reserve some for those who really need this vaccine. So we are kind of walling off a few. But our expectation is this week, next week, and hopefully the week after, that we can at least maintain 4 days of vaccination a week. We were down to 2 days a week with the number of vaccines we were getting previously.
Doc, is there any talk of what this shot for young women as far as in the future? Is there, I don't know how you study. A lot of these women have not had an opportunity to have children, families like this. Mandatory to go into a college. And I'm not on either side. I'm just saying mandatory. They say, well, okay, decision I make 19 to go to college. Is this going to harm me in the future? I'm sure there's worry and concern like that. Is there any verbiage in the medical community about how it's impossible for that to happen or anything like that?
That's correct. There's no impact on fertility from any vaccine, and certainly, we know how COVID vaccine protects people. We know how it builds immunity. It has no impact at all on fertility, either for women or for men. It doesn't affect sperm count. It doesn't affect ovulation. And really, you look at the opposite. When people get really sick, that impacts fertility. And inflammation processes, in women in particular, it can impact fallopian tubes. Certainly ovulation process can be impacted. So the healthier somebody stays, the more likely when they are ready to have a child that they will be able to. So as an OBGYN...
I was going to say, that's your wheelhouse.
Right.
That's why I'm asking.
As an OBGYN, without a doubt, and the American College of Obstetricians and Gynecologists, the American Society of Reproductive Medicine, so those are the fertility, the experts in the fertility field have all strongly recommended that their patients get vaccinated.
So they see nothing in there for, there could be birth defects, nothing like that. They see nothing in there.
Absolutely correct, yes. And so I know there's a lot of rumors that go flying around, but there's absolutely no truth to those. And apparently the fertility impact rumor was started by some guy in England named Zed Phoenix. Now, I'm not sure, who I would limit taking my medical advice from, but some guy who goes by the name of Zed Phoenix and shows up on YouTube is not at the top of my list to get medical advice. And people, I think, really, again, should reflect back that it's way too easy for anybody to throw stuff out there, and then it just kind of catches on. And I get back.
You mean
again
everything
to,
on Facebook isn't true?
And people are making decisions that they impact not just their health, but potentially their lives or the lives of people around them. They should be, I'm not here to force anybody to get a vaccine. But it's important to me as a physician and as a public health practitioner that people should be making informed decisions. And you cannot make an informed decision if you don't have good information. And so people should talk, again, if they're hesitant, they should talk to their doctor, they should talk to the nurse practitioner, get good information, not just what floats around on a website.
So for anybody looking for Pfizer, they can go. There are other sources besides the Calvert County Health Department, because I do know the Wise Pharmacy in Lusby, they've been giving out Pfizer vaccines.
Well, I thought they said you were going to have to get a third Pfizer shot now in 12 months. Is that true?
So there was the CEO of Pfizer went in front of the cameras one day and was talking about this, that, and the other, and mentioned the third dose. At this point, there's no reason to think that there will be a need for a third dose. Mm-hmm. I think that we all expect that because of the variants, that there will likely become a point where a booster or a supplemental, that would probably be a better way to say it than a booster, because a booster implies that it's the same strain, you're just upping your immunity, that when different variants, and the Brazilian variant is the one that we're really keeping our eye on right now, because the UK variant, the New York variants, the California variants, those all, and the South African, those are all still being controlled really well with the vaccines we have right now, but the Brazilian variant isn't. Right now, the levels of transmission of the Brazilian variant in the U.S. is still very, very low. If that should change, then we know that a supplemental vaccine that would cover that variant would be important. So, again, I think it was kind of sloppy language that the CEO of Pfizer used, but at the moment, there's absolutely no sign that the immunity from any of the vaccines we have right now is wearing off. It will eventually, but I've said before. Yeah,
Commissioner
yes,
Hutchins?
Commissioner Hutchins.
Doctor, you've covered a lot of different things, very complex, but the bottom line is, if you would reiterate, get a vaccine, continue to practice the safe practices that CDC has proffered, and will continue to progress through this.
Absolutely.
Right.
So when you're ready to retire from your current job, we're happy to have you come over and work with us at the health department. So yeah.
I'm just a dumb farmer, but
Tim
I've already
retired?
figured
I
out
don't think so.
it's going to be like a flu shot.
Yeah.
And it may be. And
It's going to turn out like a flu shot, and every year you're going to have to
I'd
get
be
a shot.
better off finding a revolution somewhere to take part in.
I think you're going for your 15th pension right now or something.
I think we've all learned that you can only predict so much
Yep.
with the way things unfold. And certainly speculating what we might or might not need to do 6 months or so from now, it's a fool's errand. The important part is we keep ourselves healthy, we keep ourselves safe now, and we continue to adjust as the virus shifts and as science continues to learn more and more.
All right.
Are there going to be any long-term complications from these shots? Has there been any research done on that by any chance?
To this point, other than those rare blood clots with Johnson & Johnson vaccine, we have not seen any problems. I was going to put in a few slides about, because Commissioner Hans brought up last time about rumors about changing DNA. It can't change DNA. I'll pull those slides back out because I want to talk about the Johnson & Johnson vaccine.
Okay.
But no, this is, and especially the mRNA vaccines, I think that they are the wave of the future for vaccines in general. That they're extraordinarily safe. They are easy compared to previous vaccines. They are much, much easier to shift when we see, and I think flu vaccines will be revolutionized and others. I hesitate to use the phrase, but I will use it in this instance. Really, a miracle of medicine, a miracle of science, that we have vaccines that have been gotten out to people who need it so quickly, so safely, and so effectively. We still have not had anyone hospitalized who has completed their vaccine series locally. I can't speak for everywhere. There might be an exception. But the people that we're seeing in the hospital, for various reasons, either weren't able to or delayed getting vaccinated. All of my family have been vaccinated. I can't emphasize enough how important it is for people's individual health and how important it is as a humane gesture to others, that you don't want to be the vector of transmission that could cause somebody else to get very sick. And I just want to finish up by saying that the next 2 Tuesdays, I'm not going to be here, but Dr. Folsom will be doing a guest appearance. So please be nice. I know you're always on your best behavior.
I thought we were nice.
Actually, I'll say one plug. I know Calvert County Parks and Rec is getting ready to come on probably later, but we are having a walking challenge, the Health Department and Calvert County Parks and Rec. So much to your point, I think it's a really important time for us to get moving, to get people healthier, and that's kind of what we're there for, and that's what we're all about. So please have people join the walking challenge.
Thank you. We look forward to seeing you.
Yes.
We may not invite him back. Just saying.
It may be my Wally Pipp moment. And
Right.
For any non-baseball fans, that was the first baseman for the Yankees who missed a few games. Lou Gehrig took over, and then that was the last you ever heard of Wally Pipp.
Yep.
So,
At least you're prepared. Thank you, Dr.
Thank
Folsom.
you. Thank you
Have
all.
a great day. So the next item on the agenda is proclamations. Commissioner Weems.
Yes, sir, Mr. President. The first proclamation is Month of the Young Child. And do we have any representatives for Month of the Young Child in the
I think
audience?
we gave this
Yeah.
one to Steve because he's the youngest, right?
Yes.
On the board.
Yes.
Yes.
Good morning, Commissioners. This is Julie Machina with the Family Network. I'm here for the proclamation.
Thank you, Julie. Whereas the Interagency Council for Families and Children, Calvert County Public Schools, the Calvert County Early Childhood Advisory Council, and other local organizations, in conjunction with the National Association for the Education of Young Children, are celebrating the Month of the Young Child. And whereas by calling attention to the need for high quality, early childhood services for all children and families within our community, these groups hope to improve the quality and availability of such services. And whereas many child care providers have, at great personal and professional cost, managed to keep their doors open during the COVID-19 pandemic in order to support children and families in Calvert County. And whereas the future of our community depends upon the quality of the early childhood experiences provided to our young children today. Now therefore be it proclaimed by the Board of County Commissioners of Calvert County that April be known as the month of the young child in Calvert County, urging all residents to recognize and support the needs of young children in our community. Be it further proclaimed that by this action, the Board of County Commissioners commends all child-serving organizations for consistently demonstrating superior initiative, leadership ability, support, and commitment to the children in our communities, thereby strengthening families and improving outcomes for Calvert County children. Given under our hands and seal this 27th day of April, 2021.
Thank you, Commissioner Weems.
Yes, thank you.
So the next proclamation we have is for Fair Housing Month. Whereas April 11th, 2021 marks the 53rd anniversary of the passage of the U.S. Fair Housing Act, creating a national fair housing policy to ban discrimination based on race, color, religion, national origin, sex, familial status, or disability. And whereas every American is entitled to freedom from discrimination in housing, and whereas the Fair Housing Act reflects America's determination to ensure appropriate housing and services are available to all without discrimination at each stage of one's life, so all can remain in the community as they grow older, and whereas it is imperative to provide all Americans access to housing opportunities and supportive services in order to find affordable housing or to buy or rent, regardless of socioeconomic status or varying abilities, thereby strengthening economic stability, community health, and human relations by diversity and integration. And whereas the talents of grassroots and nonprofit organizations, housing service providers, housing professionals, financial institutions, elected officials, state agencies, and others must be combined to promote and preserve integration, fair housing, and shared opportunity in every community, and to address the immense challenge of ensuring that every person in Calvert County has access to housing. Now therefore be it proclaimed by the Board of County Commissioners of Calvert County that the month of April be known as Fair Housing Month in Calvert County. Be it further proclaimed that all citizens are urged to celebrate the value of harmonious and diverse communities of neighbors and support the goal of equal housing opportunities for all people. Given under our hands and seal this 27th day of April 2021, signed by all 5 commissioners. So do we have anyone here for Fair Housing Month?
Mr. President,
Yes.
to
Commissioner
speak on that issue and just reiterate, in 2019, we convened a task force, a housing task force led by Jennifer Moreland, Director Moreland. So we lean forward on this issue, and we'll see that come to fruition as we move through the comprehensive plan and the town center plans. The focus on housing opportunities for our young people who have just left high school or returning back from college or military service with young families, and at the same time to focus on the aging population as they begin to age and make sure we have properly located assisted living facilities and housing close to medical campuses for them.
Thank you, Commissioner Hutchins. So the next proclamation we have on the list is Archaeology Month. Commissioner Weems.
Thank you, Mr. President. Do we have any representatives for archaeology? All right.
Good morning, Commissioners. Mary Beth Cook, Director of Planning and Zoning, with us today to accept the proclamation, and thank you very much for recognizing Archaeology Month. We have Stephanie Sperling, President of the Council for Maryland Archaeology, and also joining us virtually is our historic planner, Christopher Sperling. And if you notice the names, they're married. So thank you very much for recognizing, and they're going to be accepting on our behalf.
Very good.
Morning.
Morning.
Good morning, everybody. My name's Stephanie Sperling, and I'm the president for the Council for Maryland Archaeology.
Welcome.
Thank you.
And did you have any prepared remarks, or would you like me to read the proclamation to you, madam?
Well, I'd just
First or after?
Well, I'd just like to say on behalf of the council, thank you very much for this proclamation. You know, Calvert County has hundreds of archaeological sites going back thousands of years to the time that people first stepped foot in this part of the world. And Calvert County is a real leader when it comes to protecting and preserving cultural resources. So thank you for the work that you've done.
Thank you.
Thank you so much. Whereas every April since 1993, the state of Maryland has celebrated the importance of archaeology. The theme of this year's Maryland Archaeology Month, the archaeology of healing and medicine, bears added significance as the citizens of Calvert County continue to persevere throughout the challenges of the coronavirus pandemic. And whereas organizations such as the Maryland Historical Trust, the Archaeological Society of Maryland, the Council for Maryland Archaeology, Preservation Maryland, the Maryland Department of Transportation, as well as several other state, local, and private entities co-sponsor this celebration. And whereas the stories of countless Marylanders and residents of Calvert County are to be found only in the materials they left behind. Recent excavations at Calverton, our county's first seat, saved valuable information about our colonial antecedents. Michael?
I was just thinking it. I'm glad you got that one.
All right, sir. From the effects of sea level rise.
See, Steve, I just skipped those words I don't know. So when you guys hear me reading it and go, did he miss something? I saw it. I just couldn't pronounce it.
And whereas it is essential to celebrate contributions made for thousands of years by those who preceded us, especially those otherwise forgotten in the text of history. And whereas Calvert County is pleased to join in celebrating this special month to promote the value of archaeological resources and reflect on the vital role of archaeology in revealing the county's unique legacy. Now, therefore, be it proclaimed by the Board of County Commissioners of Calvert County that the month of April be known as Archaeology Month in Calvert County. Be it further proclaimed that we invite all citizens of Calvert County to join in recognizing and participating in this special observance, given under our hands and sealed this 27th day of April, 2021.
You see my good smile going here, Kevin?
Absolutely. Very charming. Here we go. One more time. Awesome.
Congratulations. Thank you.
Steve threw your chair all the way over there and the thing went off. The fluid.
So the next item, the last proclamation, Commissioner McConkey.
Yes, I have a proclamation here for Robert Reed for his years of service on the Planning Commission. Whereas Robert Reed has faithfully served the citizens of Calvert County as a member of the Calvert County Planning Commission since July 2005. And whereas Robert actively participated as a citizen planner in the preparation, deliberation, and approval of 2 updates to the Calvert County Comprehensive Plan, adopted in 2010 and 2019, the Solomon's Town Center Master Plans, adopted in 2009, the St. Leonard Town Center Master Plan, adopted in 2013, the Calvert County Land Preservation Plan, Parks and Recreation Plans, updated in 2006, 2014, and 2018. Whereas during his tenure Robert also recommended land use regulations to implement the county comprehensive plan, reviewed capital projects for consistency with the county's comprehensive plan, and helped implement the state's 12 planning visions and 57 sets of text amendments to the 2006 Calvert County zoning ordinance. And whereas consistently demonstrating studious knowledge of planning issues and intense interest in the future welfare of Calvert County, he attended special meetings, forums, and public hearings, in addition to monthly meetings, serving with prevailing team spirit among fellow Calvert County Planning Commission members. And whereas Robert joined the Maryland Planning Commission Association Board of Directors in 2012 and served as a general manager through 2014. He was elected and served as vice president in 2015 and president in 2016, and served in that role through the end of 2018. Whereas the Board of Calvert County Commissioners presents this proclamation as a tribute to Robert Reed, recognizing the commendable accomplishments made during 17 years of distinguished service as a member of the Planning Commission and his efforts to improve the quality of life for Calvert County citizens. Now therefore be it proclaimed by the Board of County Commissioners of Calvert County that the appreciation of all Calvert County is hereby extended to Robert Reed for his many years of outstanding service to local government. Be it further proclaimed that the Board of County Commissioners of Calvert County join with the family, friends, and fellow citizens of Robert in extending best wishes for continued success in all his future endeavors, given under our hands and seal this 27th day of April 2021.
Mr. Reed, or gentlemen.
Just a few comments. I'm Steve Jones, the chair for the Calvert County Planning Commission.
Into the mic.
Yeah.
Come on. Commissioners, thank you. Steve Jones from the Calvert County Planning Commission, current chair. Just a few things about Mr. Reed. Mr. Reed's served 20 years on this commission, which is a pretty amazing feat. And I think that's 5. You've been through 5 boards, sir? Yeah. Outstanding. He's elected as the president of the Maryland Planning Commission from 2015 to 2018. Mr. Reed has served on the Citizens Advisory Committee for Calvert County and Social Services Committee. Mr. Reed is currently on the Republican Central Committee and has been on there since 1998. If my math's right, that's 23 years, sir. Outstanding. I want to say Mr. Reed brought a lot of levity and humor to the Planning Commission. And I've spoke to every one of these commissioners, Mr. Reed, about you and the planning commissioners. And everyone had positive things. In particular, Commissioner Hutchins had just very high marks for you, and everyone in this room appreciates everything that you did for us. And we greatly appreciate everything that you did. One of the comments I'm going to make, and it's one thing that I'm going to promise you that we're going to carry on for you. And that is that you always treated the citizen that came in to make public comment like they were the most important person in that room, and I will carry that on. God bless you, and thank you, sir.
Mary Beth Cook, Director of Planning and Zoning. I also want to thank Mr. Reed for his dedication, and as a staff member, he always made sure he welcomed us to the meeting, asked any questions initially, but always came prepared, and during the meeting asked the really important questions, and I appreciate that, and I wish you nothing but the best.
Thank you for that.
You're welcome.
Good morning, Commissioners. Paul Conover, Planning Commission Administrator, relatively new to the department. But with my time with Mr. Reed and everything I've learned about him, I'm honored to know him. And that there are people like that willing to dedicate their lives to public service. So thank you, Mr. Reed.
Thank you, Paul.
Thank you.
Mr. Reed, would you like to make some comments?
Yes, one in particular. My father did his amphibious training in Solomon's Island in 1943, and never forgot it. When I moved to Calvert County in the late 80s with my wife and daughter, my father made it a point to remember that experience from Solomon's Island. It was such a wonderful place to be, getting a good home-cooked meal from local residents and the happiness and the sunshine of the people who lived in Calvert County. I never got it. And I want to thank this board for the privilege and the honor of being on our Calvert County Planning Commission. Thank you, gentlemen. Thank you.
Thank you.
Commissioner Hart, one last comment. I worked out this morning. I don't want you calling me overweight in Calvert County. Hey, Commissioners, would you mind if I got a shot with you guys?
Sure, come on up. He was trying to read.
Scooch in just a little bit, gentlemen.
Yes, sir. Commissioners, thank you. I'll see you.
So the next item on the agenda are the consents. Item 1, Department of Parks and Recreation Environmental Sustainability Policy. Item 2, Department of Human Resources Annual Health Insurance Renewal. Item 3, Department of Community Resources Budget Adjustment for Supplemental Nutrition Funding. Item 4, Department of Finance and Budget FY 2022 Heroin Coordinator Grant Application. Item 5, Department of Finance and Budget Capital Improvement Project Budget Adjustment Request from Board of Education. Item 6, Department of Finance and Budget Award Recommendation ITB 2021-015, Hauling and Disposing of Sewage Sludge. Item 7, Department of Finance and Budget Award Recommendation ITB 2021-051, Irrigation Sprinkler System Installation. Item 8, Department of Finance and Budget Award Recommendation ITB 2021-063, School Ball Field Mowing. Hearing no objections, the consent items will be adopted. Next item under new business, Department of Finance and Budget Award Recommendation ITB 2021-022, Pavement Overlay and Maintenance. Commissioner Hart?
Yes, sir, Mr. President. Background. The purpose of this contract is to provide pavement overlay and asphalt maintenance for the Department of Public Works. The overlay program is comprised of multiple contracts and proactively provide infrastructure improvements, repairs, and maintenance. This contract is for a one-year period with the option to renew for 4 additional one-year terms for 2 steps of an 8-step process that comprises the overlay program. The previous contract for these 2 steps was awarded to C.A. Bean, Inc. on September 18, 2018 and FY20. The county expended $2,864,215.71 for this service amount varies based on infrastructure conditions and needs in the other 6 steps of the process. Discussion. During the weeks of January 31st, 2021 and February 7th, 2021, advertisements appeared in 2 local newspapers, the Purchasing Bid Board, e-Maryland Marketplace website, the county's Facebook page, soliciting bids for a reference contract. 4 bids were received and opened during the virtual bid openings on February 26, 2021. The bid tabulation for the bid opening and bid comparisons are attached. The bids were thoroughly reviewed and the apparent low bidder, C.A. Bean, Inc., was deemed as non-responsive because it does not have a job mix formula meeting the requirements of the specifications. The second apparent low bidder, Barden, Inc., doing business as Aggregate Industries, meets all requirements of the specifications. Reference checks of Barden, Inc., DBA, Aggregate Industries provided satisfactory comments. In addition, Barden, Inc., DBA, Aggregate Industries have provided satisfactory service to the county in the past. Fiscal Impact. Funding for the contract has been allocated in the Highway Maintenance Paving Account 252-27065 and various capital project accounts. Conclusion recommendation. In accordance with Section 6-101 of Code of Public Laws, it is recommended that the Board adopt staff's recommended findings in attachment A and award the unit price contract to the lowest responsive bidder, Barden Inc., DBA Aggregate Industries, Greenbelt, Maryland. Mr. President, make a motion to adopt staff's recommendation with Barden Inc., DBA Aggregate Industries.
Second.
Have a motion and a second that we adopt the bid. Any discussion on that motion? Hearing none, all those in favor say aye.
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 Opposed? Motion carries 5-0. So the next two items under new business are Parks and Rec issues. If the Director Nizal, if you would like to take those, please.
Of course. Good morning, Commissioners. The first one we have is 2021 fees for a new women's softball league. Background, the Department of Parks and Recreation Revenue and Fee Policy and associated revenue and fee manual were adopted by the Board of County Commissioners on October 29th, 2019. The manual provides a fee schedule that is reviewed and updated, if necessary, annually by the BOCC. The 2021 fee schedule was approved by the BOCC on June 9th, 2020. The recommended pricing for this program does not match the pricing in the fee schedule for adult softball of $575 due to a truncated game offering. Discussion. Based on the policy's tier structure, this softball league is considered a Tier 4 program where the department would expect revenue-producing cost recovery. All Tier 4 programs and services are required to maintain revenue above costs of at least 10%. These services are those where the individual participant or user group enjoys the benefits of the service exclusively or a heightened level of service over the basic need. The fee proposed for the adult women's softball program is $400 per team. Fiscal Impact. This program will generate approximately $2,000 in revenue to the county's Special Revenue Parks and Recreation Fund, or Fund 5. Conclusion recommendation. Staff recommends that the BOCC approve the suggested fees and direct staff to add the current 2021 fee schedule and add to the current 2021 fee schedule for Parks and Recreation services.
Any questions?
Move to approve.
Second.
Have a motion and a second that we approve the fee request. Any discussion on that motion? Hearing none, all those in favor say aye.
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 Opposed?
Opposed.
Motion carries 4-1. Commissioner McConkey in opposition. Next.
Okay, next is a 2021 fee adjustment for Therapeutic Recreation Camp Calvert. Background, the Parks and Recreation Revenue and Fee Policy and associated revenue and fee manual were adopted by the Board of County Commissioners on October 29th, 2019. The manual provides a fee schedule that is reviewed and updated if necessary annually by the Board of County Commissioners. The 2021 fee schedule was approved by the Board of County Commissioners on June 9th, 2020. Camp Calvert is a 4-week summer camp designated for youth with various special needs who are unable to integrate into our general summer camps and includes transportation. The fee schedule currently approved indicates a cost of $700 per individual. Discussion. Based on the policy's tier structure, therapeutic camps are considered a Tier 2 partial cost recovery program to provide an opportunity for all residents and contributes to quality of life in our community. Staff proposes a decrease in registration fees to $475 per individual as transportation services will not be provided for Camp Calvert in 2021 due to COVID-19 safety precautions. Fiscal Impact. This program will generate approximately $14,250 in revenue to the county's Special Revenue Parks and Recreation Fund, Fund 5, to offset expenses. In fiscal year 2019, this program generated $21,000 in revenue to the county's Special Revenue Parks and Recreation Fund to offset expenses. Conclusion recommendation. Staff recommends that the Board of County Commissioners approve the proposed fee of $475 for individual registration for Camp Calvert and direct staff to add to the current 2021 fee schedule for Parks and Recreation services.
Motion to approve.
Second.
Have a motion and a second that we approve the fee request for the summer camp. Any discussion on that motion?
Shannon, it sounds like it went down in cost.
It did. So the reason that this one went down in cost is because we are not offering transportation services this summer due to the COVID-19 restrictions and being able to feasibly get a number of kids into a bus scenario. So we're not able to accommodate this year.
Any other discussion? Hearing none, all those in favor say aye.
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 Opposed? Motion carries 5-0. Thank you, Director Nizal.
Thank you.
So next item on the agenda is presentations. I believe Director Nizal's coming back.
All right, good morning again, Commissioners.
Morning.
Shannon Nazal, Director, Parks and Recreation.
Mike Marr, Chesapeake Hills Golf Course General Manager.
Morning.
Morning.
Okay. So today we're here at a request by the Commissioners to discuss operations at the Chesapeake Hills Golf Course and some of the items that we have been working on over the past year or so as far as improvements to the course and our operations. So a little bit of background on some of these some of this financial information, which is actually very good news for the county and the golf course operations. So the numbers that you have in front of you, these were back from March as far as year-to-date totals for FY21. I checked the numbers this morning, and our revenues are currently for FY21 just over $746,000 with a busy 2 months left to go in the fiscal year for this season. So we're expecting our projected FY21 revenues to be between $870,000 to $1 million for this fiscal year, which with all things COVID related, the one thing that has occurred is that there has been a great increase in the number of individuals who are coming out to play golf. Because it's one of the things that you can do fairly easily while social distancing.
Shannon,
So
would you,
go ahead, I'm sorry.
I say, would you say that's the highest revenue we've ever seen, or close, or?
It is. This year is definitely the highest we've seen since we've owned the course.
Will the golf course actually be in the green and make money this year for the first time?
It does look in the green.
Golf analogy.
No pun intended.
No pun intended.
It does look that way right now. As it stands, we have an excess revenue of almost $98,000, and that's at this point with another 2 months to go. So with that, we're expecting, because our expenses, as you can see on the slide, our expenses total year to date for FY21 at the time of putting together this presentation at $556,000 is already less than the revenues that we had brought in for this fiscal year. And now it's even gotten a little better, as our expenses right now that I pulled up this morning through period 10 is just over $648,000 in revenue with 746, or in expenses with 746 in revenues for this current fiscal year.
I hear a lot of that has to do with the hot dogs they're selling there.
Hey,
Yeah.
they do a great job out there.
Right.
You guys have heard my firm belief has always been, and I remember as a child, I had the pleasure of talking to somebody who was very integral when it went from private to another person, and then eventually where we picked it up, and he gave me a lot of history. You know, that place has been successful so many times, so many years, and I always knew, you know, I mean, it needed some attention when we got there, you know, and it's just taken a while, and now we're seeing it. I mean, I always in my heart of hearts, I knew not only would it not cost us any money in the future, but it could pay for itself, and I know that's a path we're on. These numbers are reflecting it, and you guys are just doing a great job. I mean, you guys are just really doing a fantastic job.
Yeah, staff is definitely doing an excellent job making sure that that we maintain the property as best as we can, that we keep the greens green and growing, and that we're working very quickly as we can on some of these infrastructure improvements that we have going on, which we'll talk about a little bit later in the presentation. So in last year in 2020, we had a business plan completed by the National Golf Foundation. So they're known around the country for assistance with feasibility studies and business plans, and they are in the business. And when going through the projections with them based on the numbers that we previously had and work that we were planning going forward, including the new clubhouse facility and some of the other improvements that we've been working on, they came up with projected revenues and expenses for fiscal years 22 through 27. So you can see on that yellow line at the bottom of what the projection was, and these were before we kind of knew what COVID was going to do to play at the golf course. So they're probably a little bit off, because we have this little bit of an increase now. I would expect that the COVID effect is going to diminish a little bit as more things are opening up and there's more different activities for people to do safely. So I do expect that number to go down a little bit. But as we bring on the new clubhouse facility, and people have seen what the course looks like now and they're able to play it now, and we've been able to gain those customers back who we may have lost in the past, or if they've never played our course before, they're seeing the quality of that course, and we're gaining a lot of new folks coming in that have seen the course that now are going to kind of put that in their rotation of courses that they play. So we have seen that increase from there. So what you see was based on, in this slide, is based on when we have the clubhouse in place and looking at a prior to COVID time, that these would be our net projections once the clubhouse is in place and we're able to offer those tournaments and different types of activities at the course to bring in more revenues to that facility. So that net does not include paying back for the clubhouse, but that funding could pay back for the clubhouse or pay back for some of the capital improvement projects that we've been working on that could come out of what's currently being paid out of general fund to reduce that ask in the future.
And I don't know about you guys, but that's always been my intent, that it's self-sustaining. Mm-hmm. You know, that it's one amenity that the county provides that, you know, people will say, hey, I don't golf. Why does my money go there? Well, it's not costing you anything, mm-hmm. You know, so I think that's the goal for me anyway.
Well, the other part of that, so the other part of that is it offers a tremendous asset to the region, and it's not just those from Calvert that participate down there, but it's very important to note too that the high schools have adopted it as their main course. So that's another plus for those going to high school and want to engage in that type of sport.
Absolutely.
Mm-hmm.
Yeah, absolutely. Yeah, we have all 4 high schools using Chesapeake Hills as their home course currently.
And Tim, they want you to ride the car out there to get the golf balls so they can try to hit you while you're in the car. That could be a good fundraiser, you know?
There you go.
Yeah.
That's it right there.
Okay, so what is of most importance right now for our golf course operations is the progress of the clubhouse facility. So right now we are at 90% design drawings for the clubhouse. We have received those. We have made comments with the consultant on those. We did receive concept site plan approval from the Planning Commission last week. So we are in the process, continuing on with our permitting and design process to get us to construction as quickly as possible. What we have noticed with the design and some of the estimates that we're getting back from the consultant is that the current cost of the clubhouse is a little bit higher than I was hoping and anticipating, and I'm thinking that it has a lot to do with the cost of materials currently that have skyrocketed across the country. So we're hoping that will level out a little bit more by the time we get to that construction phase. So as we're looking at some things, we're trying to see what we can use as an ad alternate, as kind of well, this is a nice to have, but we don't need it to open the clubhouse. So to get some of those costs down as best as we can. But as it stands right now, our estimate is about $3.8 million at the 90% design drawings, and our budget is about 3.6. And let's see, so we are also working on some marketing efforts, which includes a new website for the golf course, which will detail our course layout. It'll have weather features, tournaments and golf offerings, also avenue for folks that are looking for planning a wedding or an event at the course. And we're also going to be working on rebranding the course with new logo and branding materials as well as we get closer through the design of the clubhouse itself. The last bullet there says on track for September 21 groundbreaking. We did receive an update on the 20th of this month that groundbreaking would possibly move out based on the schedule that we have. We're trying to work as best as we can to keep that September groundbreaking as best as possible to as we move through the permitting process. So we're
I think
working
it's
very hard
highly
at that.
possible, Shannon. I think it's highly possible.
I know you do.
With a little bit of motivation across the board, I think that is highly, highly, highly possible, because this is not a new thing that this board has talked about doing. So there's no mysteries here whatsoever. I feel very, very confident that that can be attained.
Would you like me to look into that, Commissioner?
I would be delighted, Mr. Administrator, if you would. Yes.
Private administrator.
No, that's general administrator. I would be delighted for some hands-on facilitating of that date. I would be delighted.
And as staff, we'll do everything in our power to make sure that
I know they will.
we maintain as best as we can.
Will.
Absolutely. So now for the fun stuff. So as a part of our 90% design drawings, we did receive some renderings of what the clubhouse is going to look like. So if you remember back when we started on the concept of the clubhouse and what it potentially could look like in size, we've kept with that. We've kept with the around 8,100 square feet of the indoor facility space with a Southern Maryland barn type feel to the facility. The overhang there, as I did mention before, are some things that we're looking, what are the nice to haves, but we could probably back out a little bit of to save a little bit of money. So one of the things, say the overhang is out a little bit further, we could shorten that up to save a couple of bucks. So we're looking at different little things that we can change to be able to save our budget and make as best use of those dollars as we can.
I think that sets it off. The
I
character.
know, I like it.
I like it. Don't take it out.
Well,
sets
it wouldn't
the
be
character.
taken out. It would still be there. It would just be a little bit shorter. And then if we have further money in the future, we can look at expanding it and making it larger later on, with potential using revenue funds at that point to handle capital projects.
I mean, how much are you going to save just by shortening that up?
Probably not much,
Yeah.
but I'm looking at every penny.
Move that
Yeah.
3.8 number.
No, not too much, but if definitely if my staff know my style, and I'm going to try to save every penny that I can.
If you go out further with it, you're going to have to redesign all the supports and everything. It's going to cost you more in the long run.
The supports and everything we're going to stay the same, so that way it would be an easy expansion. So it would just be the roof part of it, to try and, as we're looking at like the timber costs, and those are just really, really high right now. As much as I can reduce as the little bits that I can, if we can find little pieces that are the nice to have that we can add on later, we're going to look at those options just to make sure that we stay in
Remember
budget.
too, Shannon, this is presentation. When we're shopping this place around the state for people to come in, you know, a corporation wants to come in and do a tournament. Let's face it, this is business. It's about making money.
Sure.
You go to buy a Mercedes and you travel down a dirt road and you go into the showroom and there's mud on the floor, you ain't gonna buy your Mercedes there. Now, I'm not saying we gotta present a Mercedes, but golf, you know, let's face it, is a prestigious sport. You know, and it's looked at that way. I mean, you look at even the sponsors nationwide, you know, that do that. You know, you see Lexus commercials on the TV and stuff. I mean, you know, so that presentation, when a corporation brings their members down there, or somebody wants to do a wedding or something to sell this piece to help us generate money, you want to feel good about it. You want to walk in and go, wow, we picked the right place.
People are going to be talking, when that's done, people all over Southern Maryland will be talking about that.
Yeah,
So
from
I
what
don't want
we've
to cut
seen-
corners is what I'm getting at.
I'm not a big fan. Like, sometimes I look at a building and go, hey, look, this thing's like a toolbox, right? Basically, it has a function, do a job, you know? But sometimes something has to be a selling piece as well. And I think you got a nice presentation without an overabundance of funds. I don't think it's an absorb. I mean, let's face it. All you have to do is turn on TV. You see the cost of goods out here. It's off the chain. I think you're on the right path there. I like it.
Yeah, it definitely, and I don't have any of the interior renderings, but some of the interior finishings that we're working on, they do look very nice. Like, so the bar and grill setup looks very nice, and is helping us stay within budget as well, with kind of a minimalistic type use of that area.
And the barn look goes with the Southern Maryland theme,
Yes.
and our theme here. I mean, I think it's
Yeah, and if people want to rent it, I don't want them to say, I would have rented it, but the overhang's just too short. You know?
You would, Commissioner.
lost 4 weddings.
Right, lost 4 weddings because the overhang is too short.
So this is what the back of the facility will look like. So just also for your information, the renderings don't include any of the sidewalking, landscaping, or any of that. So this is just the building itself. We do have the landscaping and sidewalking in the actual design, but not in the pictures here. So one of the best features to me about the back of the facility is the indoor-outdoor fireplace. So it'll have a fireplace on both sides. So that way you have the banquet area that has it on the inside for use, and it will be gas, it will not be wood. And then the outdoor, you'll have a fireplace area as well for folks that want to have their event outside.
So with that being all wood like that, I'd probably recommend not putting mulch around the building, because that's what happened up in Owings. Somebody flicked a cigarette in the mulch and burnt that place down right there at Cheneyville.
So the back of this facility is actually going to be a fairly large patio, a stamped concrete patio that we'll be able to put a tent over and do events out on the back there. So it won't be mulched in that area, and then the patio will be surrounded by some shrubbery to kind of delineate the different areas.
Okay.
And that board on the outside is concrete board. That's not wood on the outside, that's a concrete board.
Oh, it is?
Yes.
Oh, okay.
Yep.
Yes, when we're looking at designing this facility, we want to make sure that the maintenance of it is going to stay as low-cost maintenance as possible, so we're able to have this facility for very long into the future. And this is just another view of the front side of the clubhouse.
So that's like a hardy board. I didn't know they made that where it looked like wood.
And it's already painted, it's already colored.
Yeah, it's good for like 20 years. Yeah.
I believe it's 25, yes.
Yeah.
So another few things that we're working on at the course, we mentioned the website. We also have a new social media presence for the golf course, our Facebook page, which went live in December. We're getting close to our 500 followers, and we do have a lot of people that actually check in to the golf course via Facebook. So we know that some of the people that are going out to the course, that they're telling their friends that they're at the course, which is good word of mouth marketing for us, that they're actually telling people that they're there and taking pictures while they're there of the fun that they're having at the course, or they're not so much fun of not getting a good score, but. Some other projects that we're working on. So our pole barn for maintenance has been completed. You can see that image in the top left, and also the bathroom on hole 13 has been completed, and that And then on the next
Is that
slide.
both of them now, Shannon, both bathrooms?
So on the next slide, so you can see the start of the other restroom on hole 6.
When do you think
So-
that'll be done?
Their direction, Larry's Electric is directional boring this power over towards Cove Point Winery to pick up that transformer. The walls are up, roof's on, inside's framed out, rough plumbing's in. As soon as Johnny gets that all cinched up and closed up, we can start doing sheetrock inside, or
About a month, maybe, Mike?
I'm saying 5 or 6 weeks maybe.
And are the porta potties gone?
Gone, long gone.
Good.
Yeah,
Good.
yep. No
Good.
more of those.
Good. Good deal.
Also, some of the projects, in addition to the restroom buildings, is also we've completed phases 1 and 2 of the perimeter fencing of the course. The fencing that we had at the entrance to the course looks really nice. We did it a little bit different to have some more ornamental fencing at the front of the facility, and then a more cost-effective fencing around the remaining areas of the golf course. So it does look really nice when you come into the facility
What
with
is it,
that.
aluminum? Aluminum?
Yes. So we've also sprigged all fairways and tees and filled a sinkhole on the hole 1 tee complex. So in addition to some of the actual infrastructure of buildings at the course, we're still continuing to work on the course itself to make all the improvements that we can with the funding that we have available to us. So just a quick little bit on annual rounds that we've seen from fiscal year 17 to current. So we talked a little bit before about our revenues and expenses. So it correlates to how many rounds of golf that we're actually selling at the course. So if you look at FY17, that previously was our best year since we've owned the course at 24,717 rounds. So you can see the drop from when the old clubhouse went out of commission. So that happened in January of 2018. So you can see that drop in our rounds played due to that loss of that clubhouse. In FY20, that's when COVID hit. We were closed for 54 days, and we were still able to bump up that number of rounds to almost 19,000 rounds. So what's interesting is that for FY21, when we created this presentation, it was mid-March when we created this presentation, and at that time we had 16,592 rounds. So as of yesterday, we had 20,159 rounds.
I'm sorry, Shannon, your mic dropped out. Can I hear that again?
So as of yesterday, we've now hit 20,159 rounds of golf at the course. So we're and still with the 2 busiest months of the year coming up. So we are estimating for fiscal year 21 that we'll reach over 26,000 rounds of golf, which will beat our previous best year, and we don't have the clubhouse in place yet. So it goes to show that the course itself is something that our customers like. They come back, they're telling their friends, they're bringing their buddies, and they're using the course. So again, I do want to say that there is a little bit of an outlier because of the COVID effect. So I'm not expecting it to go up to 50,000 rounds once we have a clubhouse in place.
It's all about building habits and routines.
Sure.
So I know there's this fear, what will life be whenever normal comes back, whatever normal will be. But this is a very healthy alternative. You're outside. Anybody can play golf. Anybody. It's not like it's football. And you got to go out and run into somebody type. Anybody can swing that club, and I really think that this is an upswing that's going to keep going. The high schools all participating. We're starting there. Does dad now come out and swing a club because the son or daughter is on the, thing? Does mom come out and swing? You know what I mean? So, it's a nice family venue. It really is, and you guys have done a great job.
Thank you. So we're very excited to see how this year ends up, and then especially once the clubhouse is in place, on how that's going to impact our play as well, because we do expect that we will see that increase in play once the clubhouse is in use as well. And then another interesting fact to give you now is so with our annual passes, we've fairly struggled the past couple of years to be able to get folks to buy annual passes for the course. So, because if you don't have a clubhouse and if you don't have a good course, people aren't going to buy annual passes. So, as you can see from FY21, when we did this presentation, we were already considerably higher than we've ever been with our number of annual passes. So, Mr. Marr just put a number on my sheet here of what the number currently is, which is 41. So we are considerably increasing that week over week, month over month of what people are finding important to them, and staff's doing a great job of giving those benefits to our users and letting them know what the benefits are of being a pass holder with some of those discounts. So in regards to course conditions and playability, so we use the USGA course consulting. We've used it for years. They've come in every fall to assess our course, tell us how we're doing, tell us what we need to improve, what are some recommendations, and what are they observing while they're there. So they last came and took a look at the course in fall of 2020. They did make some observations about the greens, about the fairways, and about some of our infrastructure. And one of the most important things, I believe, that came from that is that they believe that all of the infrastructure improvements and all of the projects that we have ongoing are excellent investments for the golf experience here in Calvert County and throughout the region.
Well, Shannon, your challenge is going to be, with this influx of people, the adjustment of, that's more wear and tear.
Sure.
So, I mean, Mike, I know you and your crew are all over it. I mean, these are good problems to have.
Yeah, absolutely. That's why we continuously work to make sure that we're sprigging, that all of our irrigation is working properly, that all of our drainage areas are working properly. We do have some projects in place that we work on internally on improving some of the drainage conditions, because the soil here in southern Maryland is
tough.
It's not conducive for growing lots of pretty grass. So it takes a lot of effort to make sure that we're balancing the correct amount of drainage and irrigation and consistency with our soils to make sure that we're providing the best product that we can. And luckily we have some great staff that are very knowledgeable in turf management, and with the help of the USGA and their view of the course and coming out every year to take a look at it. And I've walked with them a couple times when they've come out, and since they've been doing it for a long time, they've seen the progression in the course conditions, and they mention that every year when they come out, that it's continually improving. So we're very happy with that result and the effort that staff's put in. So as I said, that they give us some recommendations when they do come, and staff works to try and make those recommendations into actual practice at the course. So including, weed control programs, the height cut of the grass, and looking at how we can audit our irrigation methods, and what we're doing with our staffing, and how we're looking at those labor needs within the amount of staffing that we currently have. So just a little bit more information on how much folks are using this course goes into the amount of events that that are being planned. We just held the was it state high school championships, Southern Maryland SMAC championships. We just held that at the golf course. Yes, that was at another golf course previously, so we were able to take that on at our course as a new event. So including all of the high school golf team matches, and we hope to begin a regular season with all the high schools again in August. We have a couple of internal golf tournaments that we run from the Parks and Recreation Department that that benefits our Thurman Gray Memorial Scholarship Fund that helps folks to afford different programs within Parks and Recreation if they're not able to pay for a program, so they can apply for this Thurman Gray Memorial Scholarship Fund to help pay for a summer camp or a basketball program or a soccer program, that sort of thing. So we put on a few golf tournaments to be able to do that. So we do have one coming up on May 7th for anyone that is a golfer that would like to register. Had to put that little plug in there. So we also have some very significant weekends booked through September. Different fundraisers, our Under Armour Junior Tour. We had TaylorMade come out for a club fitting. This is the second time. This is the second time that they've done a club fitting out there that was pretty successful. The last time they did it as well. So as we're looking into the future for the course, we have a lot of things going on, including all of our capital improvement projects. We're also still continuing to improve on what we have and what we're able to offer our customers, including GPS software for our golf carts to be able to meet that need that our customers are looking for while they're out golfing, further website development, and also introducing some new ADA components with golf carts at the facility as well. So I think staff is doing a great job, and we're working in the right direction. And I'll take any other questions that you may have.
Mr. President.
Commissioner Hutchins.
Director, as we spoke when we went through this last week, promotional opportunities in working with economic development. Solomon's is a real gem that's right next to it as far as promoting it as part of a destination weekend or destination trip throughout Southern Maryland, but in particular is support in the Solomon's area or anywhere else in Calvert.
Sure.
But that collaboration with economic development would be a critical component there to help push this out.
Sure. So we work directly with some hotels, and we have worked with economic development to help us reach out to some of our restaurateurs in the area to that can work with those that are putting on tournaments or putting on events in the area. We have a few events that are taking place at other locations, and we're talking to them about if they want to buy some rounds of golf for their participants, and looking at with the hotels in the area to offer a stay and play packages, that sort of thing. So those are all things that we're working on, and we'll be ramping up more of that once we start construction of the clubhouse, so we can definitely promote that as a forthcoming feature.
The other thing too is an advisory group of Calvert County residents or even outside. I know Mr. Williams, a very successful golfer that started there when he was in high school. So it's those kinds of stories to be able to capitalize on and use that as an advisory team maybe to reach out to different segments of the population. You never know when the next Tiger Woods is out there.
Very true. We definitely listen closely to our golfers. Our users of the facility are not shy to let us know what they think of things going on at the course and the facility. So we definitely have a very good rapport, both with our customers and with the surrounding residents of the golf course as well. And we keep everybody as in the loop as possible with things going on. And anytime anyone has any questions or concerns, our staff are definitely on the ball to get those questions answered and get any issues that may come up taken care of as quickly as possible.
So, any other questions? So, building looks great. It's always good to see black on the books and green on the course. So, good job.
Thank you.
And we thank you. Appreciate it.
Absolutely. Oh, yes, and we do have something that we would like to present to the board that came from our junior tour, Under Armour junior tour participants that we put together for you. So there might be a future Tiger Woods autograph on this flag.
There you go.
What's that?
All the kids, we had the Under Armour Junior Tour here 3 weeks ago, and all the kids in recognition and thanking the commission for allowing them
awesome.
to come to us and have their tournaments here. They had all the kids that participated in the tournament sign it, and we framed it and presented it to you guys.
Cool.
That's great.
Very
That's
good.
great.
Thank you.
Great, guys.
Thanks, Mike. You want to get a picture with it?
Do we have a photographer? I don't see him.
Everybody out there?
Oh,
okay.
Jennifer's gonna take a picture.
He's been watching the meeting. Working. Oh, okay. We thought you slept back there, Kevin. Wake him up.
Awesome.
Congratulations. Hey, thank you. Tell everybody down there, hey, we appreciate what's going on. You know, we're going to do 93 days, and what they're doing counts. You know, it really does. You think so?
Thank you, commissioners. We appreciate your time.
Absolutely. So the next item on the agenda is Department of Community Resources Fair Housing Month presentation. Commissioner Weems.
Yes.
Or you
Mr.
can
President.
defer.
Miss Jennifer, welcome.
Good morning. Good afternoon.
No, and
Almost.
It's good to be here.
Yes.
Jennifer Moreland, Director of Community Resources, and we have on the phone with us today Sean Kingston, the Executive Director of the Housing Authority of Calvert County, joining me. Our presentation today corresponds nicely with Fair Housing Month, and we have really two purposes. Sean is going to lead you through different types of federally assisted housing in Calvert and the current data for each, which was provided in a handout, but I can give this to you as well, and it corresponds nicely with the presentation. So I'll do that when he starts talking. And that also included talking points about Calvert Hills, the newest affordable development. And I will be sharing recent insights from the Maryland Department of Housing assessment and 10-year plan, which was released this year in February by the Department of Housing and Community Development, and it was in partnership with the University of Maryland. They have a National Center for Smart Growth Research and Education. And as you recall, in January of 2020, the commissioners nominated me to serve in an advisory capacity on behalf of Calvert County government for that housing board. It was a really great experience, and it corresponded very nicely with the housing task force that we had here locally. There was some good overlap. So moving on, just want to, briefly talk about fair housing. So Calvert County has a fair housing and equal opportunity plan. You've probably seen it when we do the community development block grants, because it is a requirement of that grant and other federal funds. But part of that plan really states, to the best of our ability, Calvert County will promote and encourage fair housing choice for all of its residents. And so there's a real emphasis in it for education regarding legal protections, impediments to fair housing, and then the importance of housing diversity for all populations. We have many partners that ensure fair housing in Calvert County. One of them is the Housing Authority of Calvert County. Southern Maryland Legal Aid Bureau plays a very important role, and other nonprofit developers like Southern Maryland Tri-County Community Action. And then I just wanted to, for the public, there's a Maryland Fair Housing Roundtable discussion tomorrow, April 28th from 10 a.m. to 1 p.m. If they're interested in learning more about fair housing, they can go to the MCCR website. All right. Part of our commitment to fair housing is ensuring adequate housing for all people, regardless of their age, abilities, race, ethnicity, family, or marital status. And so you see this really upheld in our comprehensive plan and also in the goals of the Housing Task Force, which began in July of 2019. And one of the chief goals of that task force is to educate the community about our housing shortage and populations most impacted. So that's our part of our discussion today. And Sean is going to talk through a snapshot of publicly assisted housing units in Calvert County, and I'll hand out the handouts while he's doing that.
Good morning.
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 Good morning. If you haven't seen a snapshot, or if you did, we have public housing. We don't have any in Calvert County. We have tenant-based vouchers. A tenant-based voucher is a voucher that the tenant can take to any other jurisdiction that does the Housing Choice Voucher Program or mainstream program in continental U.S., Puerto Rico, Guam, or the U.S. Virgin Islands. We have 122 project-based vouchers. The project-based voucher subsidizes the unit, such as Calvert Pines 1. There are 50 subsidized units there. When that tenant moves, the subsidy stays there, and another lower income tenant can occupy that unit. They can't take the subsidy with them. The housing subsidy units that she has on her chart, she has 780. That includes things like the low-income housing tax credit, which is actually a U.S. Treasury program, but because FHA insures those loans on those properties, it does fall under HUD because FHA falls under HUD. It also includes mortgage subsidies. While HUD will supply to a nonprofit, to a housing authority, or for-profit, a mortgage subsidy to build a subsidized unit if they keep the rents affordable. This is basically what we said. HUD allocates funds to public housing authorities to build public housing. HUD is moving away from that a lot. They're moving towards it's called rental assistance demonstration. And that's what we have here in Calvert County. They had 72 public housing units, but we converted those to rental assistance demonstration, whereby a nonprofit, which we're using Calvert Affordable Housing Alliance as the manager, to develop and invest money in those properties. And each of those properties then gets what we sign is what's called a HAP contract, Housing Assistance Payment Contract, with the Housing Authority for 15 years worth of assistance for those units. Tenant-based assistance is what I talked about earlier when we was given the number. The tenant-based assistance are basically the tenant can take that assistance with them as long as they go by the rules and regulations associated with the program. They have to be income eligible, criminal history has to be good, and they have to report all their income and just not violate the program. Project-based assistance is what I described. A PHA can take our tenant-based assistance vouchers and move them to project-based assistance. We can use 20% of them for that. Then again, that takes those away from people being able to port to other jurisdictions. There's lots of reasons to port to other jurisdictions. A few of them are for medical reasons, educational reasons, or job opportunities. If someone has a job opportunity and they can't take that voucher with them, they may not be able to afford to live in another jurisdiction while they develop that job. Same thing with medical. We've had a case where a gentleman was blind and the only service he could really get was up in Massachusetts. So at the tenant-based voucher, he could take his voucher, rent a home up there while he received his medical treatments. So we generally do not allocate our 20% to project-based, and that would reserve folks for here. The other thing that we didn't talk about is on the port-in vouchers. Other jurisdictions, we talk about people porting out, but other jurisdictions can port in. When they port in, We administer their vouchers for them, but they don't count against what's called our annual contribution contract from HUD. So that's part of the other assisted units. You can move on, Jennifer. Thank you. I'm sorry.
It's okay. There's a little bit of mind reading that's involved with this.
The project base we talked about, I think you can move on with that with 20% the contract and the term. Usually do this for 15 years. Did you want to take over the rentals based on population, Jennifer? Or other housing subsidies? We'll talk about that. The lower income housing tax credits, that would be Calvert Pines 1. Excuse me. No, Calvert Pines 1 is called a Prac. That's a project rental assistance contract. These are Southern Pines 1 and Southern Pines 2. The advantage of a housing authority doing a low-income housing tax credit is we don't opt out of them like you saw down at the beaches, where after 15 years, there's supposed to be another 15 years, but there's called a qualified sale in which a lot of folks can opt out. We also have a lot of USDA down here, and the Home Partnership Investment is part of the Community Development Block Grant that Jennifer's office has helped us work with. We do appreciate that. As a small PHA, we have to go through the county to get Community Development Block Grant money, and Home Investment Partnership is part of that money. Thank you, Jennifer.
Sure, thank you, Sean. Before we move on, because I know this is a topic of conversation from time to time about all the variety of units that there are, and you know, part of providing this real detailed handout is because you could see the breakdown by different areas of the county and get a sense of what the full picture was. Sean's really the subject matter expert when it comes to all these programs, so if you have any questions, here's a good opportunity to ask them before we move forward.
So the 560 unit deficit is based on...
Sorry, I'm jumping ahead. Or we can move on. All right.
I'm sorry, that's the slide I was looking at. You asked for questions.
Right. So I'll talk a little bit about, this is data that was recently released from the Maryland Housing Assessment, okay? And it is a moment in time. So this particular slide is not looking at projections, but just now. So you're looking at the number of renters by income level versus the available rental units for that income level. So what's really interesting about this is you can see at 30% AMI, we have 1,600 renters, but only 1,045 units. There's something wrong with the slide.
So wait a minute, do that again.
Hold on. Okay. Oh, there we go. So for 30% AMI, 30% area median income levels and below, so that's your lowest, income level bracket.
So they make 30% of what the average medium income is for the area.
Correct. So
and our average income medium is?
Like between 90.
Yeah, it's around $90,000.
It's high.
So this is somebody making $30,000 a year.
And if you look at the bullet point for Calvert Hills, since this is new, that'll give you an indication. It gives you like 30% AMI, one person maximum income would be $26,500. So that's one person. And then for a 5-person household, that would be $40,850. So that's your 30% AMI.
So the 30% AMI, 50%, and then the rest. So there's a subsidy based on your percentage of AMI.
Right. So
the rental rate for the project is the same. It's just the amount of subsidy you get based on your income level.
Correct. So 30% at each of those levels, for instance, I'm going to use Calvert Hills as an example, there's a certain number of units. So at Calvert Hills, there's 10 units for 30% AMI.
So just for the public,
yes.
Calvert Hills, is that what's under construction now, or is that what's going to be constructed?
That's what is starting construction now. There's a total of 4 buildings with 24 units each.
The buildings that are already up but not completed.
Correct.
So for the public watching, that's on Prince Frederick Boulevard by Calvert Pines. Those buildings under construction right now is Calvert Hills project that we're talking about today.
Yes.
There's another Calvert Hills project yet to be built on the opposite side of the roundabout, behind Radio Shack.
Sean, are you still available in case he has questions about that? Can you speak to that next phase of development?
I am not. The Housing Authority is not part of that one. We're only a part of Calvert Hills 1. Right. Excuse me. I'm getting all messed up. Yeah, Calvert Hills, the first development. So I'm unfamiliar with that. But the 30%, generally in subsidized programs, generally families pay 30% You have a 30% income, then you have units set aside for people with that level of income. 50% units set aside with those folks and those income, 80% with those. But they pay different rates. So 30% AMI will pay less than the 50% AMIs, and the 50s will pay less than the 80s. So they are adjusted. And they generally pay 30% of their income. But so if you're at 80%, you pay 30% of your income. 50%, you pay 30%, 30%, 30%. Calvert Pines 1, for example, is restricted to 30% AMI. You have to have 30% or below AMI. And no matter what you make, you'll pay 30% of your income. If you have no income, HUD will pay the rest. And what we have is what's called a Prac, Project Rental Assistance Contract with HUD for that project that actually expired, which allowed the Housing Authority to sell that Calvert Pines 1. We decided, obviously, not to sell it, and I've entered into a new contract with HUD for the next 10 years. And we're spending over $1 million this year in renovations on that. We did raise the rents during that period because the tenants there are restricted to 30%. So no matter what the rent is, we have to get HUD to agree to go to market rent. And the tenant still only pays 30%. We were able to do that, and that's why we were able to pick up $1 million in renovation funds.
We'll circle back to that later because we're going to talk about when rental units expire.
But as far as the second development, I'm unfamiliar with that. I haven't talked to any of the developers out there for the second. We are involved in the first one.
So for Calvert Hills 1, it's a total of 96 units. A third are going to be market rate. The other 2/3 are going to be subsidized housing.
Correct. So
through HUD.
Through HUD, through the it's actually the Low Income Housing Tax Credit Program, which is through the Treasury.
U.S. Treasury Program, correct.
Yeah. Gotcha. So, so what's important about this slide is that there is a rather large gap for that 30% AMI, 555 unit deficit for 30% AMI, only 5 for the 50% AMI. So I think we've made that up with the Calvert Hills. You're good there. And there's a 980 unit surplus for the 80% AMI. So when you're thinking about those apartments, for instance, in Chesapeake and North Beach, you know, that's your 80%, and there's a surplus. So they do have a good justification for that moratorium.
So, Jennifer, I think
Yes.
I've asked before, when you look at the big picture, where do we fall? Are we, are we way behind? Are we about the normal for different areas? You get the question I'm trying to ask. How big is our deficit, and how does that compare to other regions? Are we...
Well, we don't have a lot of projected growth, right? So in a way, that supports this. And we're going to get to those slides going forward. So that's a complicated question to answer because we are very different than our neighbors.
Yeah.
So let me move forward. So when for instance, when we're looking at household income projections, the largest projections are for that 80% AMI. The question is, are they choosing to be renters or are they choosing to be homeowners, right? So that may be why there's a surplus of renters because, that market is really going towards purchasing homes.
So Jennifer, I thought there was a state requirement for a certain percentage that you must have. So if you've got 100 homes and they say you got to have 1%, well then you better have one home. Somewhere I read that, I heard that. I thought there was a percentage out there because it's not what's the word I'm looking for? I don't think that we're allowed to dial that up. I think there's a threshold that they require. We don't have to exceed it, from my understanding, but it's a requirement. Do you know that number?
I really don't, and I wonder if that's part of the comprehensive planning process. So I think planning and zoning may know that, but I don't know what that number is.
She's shaking her head now.
No,
Yeah.
there's
It's more tied to...
John, are you familiar with what I'm talking about? Somewhere I read that because this project came up several times, and I remember hearing there was a percentage.
Oh, you're talking about Prince Frederick Town Center Master Plan.
Maybe that's where it's coming from. I don't know, but I thought there was a state requirement where you must allow certain percentage at certain rate, and I just don't know where I pulled that from. And Mark, you familiar with what I'm talking about?
So, Maryland Department of Planning came out with a requirement that a housing chapter be added to the comprehensive plan as a whole. So within that plan, within that comprehensive plan, the county will look at housing distribution like this, but there's, to my knowledge, there's no set number of houses or no set percentage.
Okay.
But it is a goal that the commissioners can have.
I thought it was something mandated from the state, but I didn't-
For housing in general, yes, that you include that. That's a fairly new change to the comprehensive plan. In fact, we incorporated it as a chapter within the most recently adopted plan. It didn't mean that you couldn't talk about it before, but it's mandated now. But we'll get a better answer for you, and we can bring it back next meeting just so that we cover that for the citizens.
And this is the first of a series, really, that I want to do on this, this state plan, because there's so much to share within it. So here's the income projections, and you can see on this pie graph that the majority of growth is in that 80% AMI and greater, followed by that is the additional 910 households at 30% AMI. And below that, there's a moderate growth in 30 to 50% AMI and a decrease between 50 to 80% AMI. And I really think that indicates or illustrates a greater income gap, because you're growing at both ends, but not in the middle.
And Jennifer, is there any, I know we have some places that if you're a senior, or is there anything that helps the veterans, or and I don't even know how big that list is, but where maybe, I don't know what the right word is, but you take care of the seniors, you take care of the, you know what I mean?
Well, the good thing is there are voucher programs specifically for certain populations like veterans or disabled or, or housing facilities that are developed just for seniors that are affordable. So in that sense, yes, there are. But I will say, when you look at these increases, because we don't have the adequate housing, for instance, at that 30% AMI, they're the ones that are going to be impacted the most, that those senior and disabled populations, because that's where you see them. What I think is really interesting about that 50 to 80% AMI that's going down is that's your workforce. That's your 40,000 to 80,000. So that's your public sector workforce. That's positions like budget analysts, medical transcription professionals, pharmacy techs, claims adjusters, so it's private sector as well. So to connect back to that prior slide, we have a surplus in housing for this group, but a projected population decline in it for the next 10 years. So what will likely amount to is people at below 50% AMI living in rentals that they can barely afford. And so that's going to lead to a diminished quality of life. It could look like avoiding medical procedures or paying for insurance and to avoid medical expenses. It could look like children not participating in sports activities and clubs, or it could look like going hungry to pay the bills. So that's something we should be concerned about. Workforce projections. So also in the assessment, and this is something that you wanted to see, is economic projections that kind of corresponded with this housing assessment. So it was nice that this state assessment brought that. So from now until 2040 for labor, this is looking at for labor, per capita income, and jobs. As you can see, the income levels and jobs in Calvert County are anticipated to increase, albeit gradual, but that workforce remains flat. It stays flat around 51,500. Per capita increase is growing by about 10,000 in that period, and then jobs are going to increase from 36,800 to 43,100. I just thought an interesting point that was also in the state assessment was that during this 2020 to 2030 period, the statewide household growth is projected at 8%. So that's statewide. So when you said how do we compare to other jurisdictions, we're far below that. And the next slide shows the publicly assisted units that are not expiring and those that are at risk of loss. And this is an important piece of the puzzle that we're talking about today, because subsidized properties with expiring affordability restrictions, like aging infrastructure and poor conditions just in general, could be lost from the housing stock if there's no intervention, which will further exacerbate the housing shortage and the available rental units for extremely low-income households. And like you mentioned, that intersects with that senior, disabled, veteran, population. So they are going to experience the higher rate of severe cost burden than other groups if this happens. Sean mentioned earlier that he gave an example of how they prevented that from happening at Calvert Pines 1, which was really great. We hope that that can continue. I think it does require, in some cases, it requires partnership with the county or just being present and being involved. You know, North Beach Apartments, we lost that one.
And that was huge.
Yeah,
you remember
it
that
was.
huge. I mean,
Yeah.
senior housing is a big issue. I mean, it's, you know, especially sometimes all they have, they're on fixed income. And, you know, so, I mean, having senior housing available is huge.
It is, and they've allowed, the current seniors are still living there, and they're allowing them to live there at no more than 30% of their, income for rent, so that's good. But, you know, as those individuals move out of those units, they can move anyone there. It doesn't have to be a senior.
But see, that ought to be, and I mean, and I don't know how much control that, probably none on our side, but I mean, with all the seniors needing housing, that ought to be.
I think it's just that we really have to have close relationships with these developers. We have to be aware of when these terms are going to expire. We have to look at that schedule. We have to have early conversations with them.
Because I don't want the bait and switch.
Right.
Where, you know, you come out and say, okay, hey, we're going to take care of these seniors, and then as soon as the unit's available, well, now it's back to me and I'll just do whatever. Because that's not the intent of the program.
Yeah. And there are things you can do, like Sean had mentioned what they did in terms of, renewing continuing the terms and use the money to renovate the property, which was definitely needed. There are other things, it could have been written into the covenant, for instance, and with the new point of sale, if that was brokered with the Department of Housing and Community Development and the county, but we weren't a part of that. The county wasn't invited to be a part of that. But I think asserting ourselves more into these, processes early on when we know that there's going to be a potential for a loss, and finding out what they need. I mean, there may be legitimate reasons for them, deciding to take it to market rate. So,
oh, I'm sure.
How can we help?
Well, I'm sure. You're going to hear the financial piece
Right.
every time.
Yep.
But that's not what they're selling first coming in the door.
Right.
They're selling, hey, this is a need for the community. We're going to take care of your seniors. You have this issue, you're an aging population. And then all of a sudden, well, I've lost X amount of seniors. I'm going to do what I want. And that shouldn't be.
I agree. So going forward, here is we provided on the website and on the county's website, and then this is also available on the Department of Housing and Community Development website. There's links to this assessment and strategic plan. There's data tables there, which is where I got the data that I shared with you today. There's a housing toolbox, which has all these great suggestions on how to address the housing disparities. And this is not just a county thing. This is the state has a role in this as well, and how they develop programs. They've been very focused on, for instance, the Maryland Mortgage Program. But maybe more funds need to be put towards rehab. We have a lot of aging, housing in Calvert County and throughout Maryland. So that could be, that's actually one of the recommendations in the housing toolbox. So in terms of next steps, like I had mentioned before, this is really, I hope for this to be a presentation in a series, so I can bring this before you. And then with every presentation, I'd like to get your input and talk about next steps. So for today, I will tell you I'm using some of this information to inform and been invited to do so with the Prince Frederick Town Center Master Plan. There are these renter and housing stability index maps that are by census block. So that's really, really helpful. And it's all GIS mapped. I'd like to work with the GIS staff to get those maps up on our website too, so we can look at them. But I definitely want to use this plan to reinforce and support future planning processes. What I'd be very interested to know is from all of you, what are the kinds of questions that citizens ask you about housing? You think, I've heard some of them.
Oh, you know what it is. I moved here, don't let nobody else move in.
Right.
So, that's
the number one question.
That's the number one thing. So, and that's why identifying, look, I know we have an aging population, and we need to make sure that, but we also can't outgrow our infrastructure. So when you're saying the state's 8%, we can't handle 8%. There's no way. We got one road runs through the town.
Yeah, and we're not projected to grow at that rate.
But you know that's so when somebody comes in, and I always say they get with a real estate person, and they want to see 9 million houses to choose from. But once they buy theirs, okay, take the rest off the market. So I mean it's it's really I mean, one thing New York has always said, we have been growing within our means, and we got to make sure we stay that way.
One thing that Sean could probably share, and we saw it too in the data tables from Southern Plains too with the CDBG grant, is that a lot of the people were Calvert County individuals moving in there. So they weren't, coming
good.
from
That's
other
what it should
places.
be.
Yeah, but you can't enforce that. There's no way of it.
We currently have subsidies in place to encourage senior housing, and it doesn't matter. The developers follow the money. They're going to build whatever they make the most money on, and right now that's a $500,000 house on a 2-acre lot.
Yeah.
That's where the money is. We had a project here in Prince Frederick was going to be 150 units of senior housing. That's now changed to 375 apartments and townhouses. So, I don't know how, we can't force a developer to do a project. We've got incentives in place. It's just not enough. They follow the money, which is, you can't blame them. They're in business. That's what they do.
I am very interested to see some of the incentives that the state will develop after this plan. And maybe we can piggyback on some of those.
Well, I think though too, when you bring up what can we handle, maybe that is another discussion or work session of how we approach growth.
Correct.
Put limits on.
I mean,
Director, I think the part of the state to look for too is as to how we marry these things up with a cohort that's from 18 to 44 that's not generating the income, and being able to generate the income with the types of jobs available and then the types of housing that can match that level of income. But at the same time, it's the growing population is a statewide issue, not just Calvert County.
Right.
And we've got to be able to make sure that we place those units in a place where it's close to walking distance for their own support facilities as well as medical facilities. So I think there's a couple moving parts there that comes from the state and their studies on job growth and job availability.
I agree. And the other thing I'll mention is that, and Sean had mentioned how these units are being incorporated into developments has changed. So public housing is not a thing like it used to be. Accessory housing also plays a role here. It's an income generator for all these folks that own these real big, expensive homes, and to sustain, especially into their, as they become seniors themselves. That should be a part of the conversation too. But some of that is mentioned in the toolbox, so I'll bring that up in future sessions.
Well, the question is, where are my kids going to live because they can't afford to live here?
Correct.
Yeah,
That's
the question we get. Besides, stop building houses.
Yeah.
Right.
Where are my kids going to live because they can't afford it? So
yes, this is very true. It's this
and
duality.
like I said, and it's a legitimate question because
Absolutely.
we don't have water and sewer everywhere. You got a lot of wells failing and a lot of septics failing. We have one road basically runs through the town. We can't afford to pop out schools every other day. So I mean, it's legitimate question. I mean, especially you've heard we're a peninsula.
Yeah.
So it's one way. I mean, so it's
It's going to take some creativity. Yeah.
I think it's going to take a change of how we've approached things where, and I don't want to use the word the honor system. Like you said, you can't make people do certain things, but maybe, if it's going to cost the greater good, I mean, you just because somebody wants to do a certain thing, it's going to cost everybody else in the thing. Maybe it just can't happen. So
we'll see.
All right.
Thank you, gentlemen.
I look forward to meeting with you in the future.
Yeah.
Thank you.
Have a good day.
Thank you. You too.
So the next item on the agenda is the county administrator with an update.
Good afternoon, Commissioners. Mark Willis, County Administrator. Just real briefly, in January of 21, the Board of County Commissioners directed myself and our directors to come up with a series of goals that, that were either already on the books or that the commissioners would like to achieve as we go forward. So this is going to be a very high-level presentation, pretty quick. It's really just to validate the fact that even during COVID-19, the board directed staff to accomplish quite a bit. The previous discussion that you just heard is an example of that. So I'll go through it rather quickly. What we're going to do is continue to build upon the successes of completion of these, and we'll come back just like Jennifer's going to do with housing, and we'll give you more updates as we go. So like I said, high level, if there's any particular thing that you want to speak to, I do have some staff available, but I think just the update will be pretty telling. The purpose is just as I described. Let's see. Guidance number one, and again, I'm not going to read all of this, but what we looked at transparency in general. So transparency from the Board of County Commissioners, from staff to the citizens in general. What could we do? We're looking at any potential that we can increase our availability to the public, whether that's more consistent meetings, shorter meetings. Maybe a meeting in the evening once a quarter, but that's something that certainly COVID-19 has put some breaks to, but we're still considering it as we go forward. Our use of Channel 6, we have a very talented staff. We truly want to expand the capabilities of that particular department. I think there's so much value in what that single department can bring to projecting the Board of County Commissioners' desires and the needs of the citizens for transparency. I think that this is one gem that we've barely touched on, so I look forward to it. The other thing, and again, we want to have that increased interaction from the citizens. CMR is going to do that. A lot of what I just talked about with Channel 6 is going to help really bring that to the forefront. There's a dashboard that we have put into place, and let me make sure I'm here. There's a dashboard that CMR has put into place some time ago. And what it does is it provides a kind of a direct link to the citizens so that they know the progress that we've made. Each department has a link that you can go to. If it's planning and zoning, for example, you can see what they've done for inspections, permits, for reviews. If you're going to Parks and Rec, you can see how the fields have been upgraded, et cetera. And the link that's on here, you can go to the county website. And then by selecting Calvert Stat, that's going to take you to that link directly, and you can look at any of the county departments. So again, that's at their fingertips. That's on the website for them. Guidance number 2 is continue the efforts to expand services to those in the underserved or unserved. Specifically for this one, we're talking about the ability to get broadband and internet services out to all citizens in Calvert County. I give a lot of credit to the deputy administrator, her ability to work directly with Comcast and to really bring in not consolidating just monies from that were authorized by the Board of County Commissioners, but also grant monies that are available through Comcast. It's been a great partnership with them. Right now, we're looking at a completion date of roughly 12/31/21, so the end of this year. We think we're still on target for that. And the good thing about this is that we have a briefing that'll be coming up here in the very near future. The one thing I would like to say is a public map. What we wanted to do, and again, this goes back to transparency, we wanted the citizens to be able to actually track the progress that we're making. So as these programs are loaded into the GIS mapping, and they're actually Comcast is going out and updating this broadband upgrade, you can actually follow it. So you can go into a particular neighborhood, and if it's your neighborhood, you can say, oh, they're making progress along the residential housing units in that area. but of course they could look into any of the mapping designations if they want to. So this, we worked with Comcast to make sure that we were authorized to do this, and they've given us authorization to do it, so that'll be coming out real soon. There's a lot on this page. This is, I'm not going to go into much detail because this is exactly what Director Moreland just gave you a brief on. At the direction of the Board of County Commissioners, we're really taking a detailed look at housing for all, and I think that's the key there. And I will say that the commissioners should get a lot of credit for the fact that we're looking at where housing exists today and where we need housing tomorrow. So it's not just bunching up in one area. It's really to look at across the county spectrum and make sure that we're putting it where our citizens need it. Number 3, business climate. This just never stops. I mean, I think it's something that we have to do to make sure that the county stays vibrant. In this particular case, planning and zoning, they're already looking at the zoning ordinance. Within the zoning ordinance, I think a lot of folks confuse the comprehensive plan, which is a visionary document. For example, the document says that you want to retain the rural character, but you want to move density to the town centers. You want to move economic growth to the town centers, and you want walkable, sustainable communities. That's what this first bullet here really talks to. It's the zoning ordinance that decides density and where it can go and how much you can put where throughout the county. So the zoning ordinance is already in an update process. They've been through the first draft. They'll be going into the second draft and beyond until they bring it back to the Board of County Commissioners. So there are dates in here. I won't stick to those dates because COVID has definitely slowed things down a bit. But I will tell you that staff continues to work very diligently to get us to that third draft and then, chapter by chapter before both the citizens and the Board of County Commissioners.
So is the zoning update a staff project or public involvement in that project?
It is absolutely going to be both, sir. Just like the comprehensive plan, it's a public document. To get it in front of the citizens as should be, you have to get it to a point where we have the updates from the consultant. We put it in front of the citizens and the Board of County Commissioners, and then it's really back and forth. The one thing I would say, the difference in the comp plan, besides it being a visionary document versus it's kind of like your driver's license handbook tells you how to drive, but the police officer's ticket book tells you exactly what you can do. The comprehensive plan is a vision, but the zoning ordinance actually allows for that vision to come true. When you get into the comprehensive plan, an individual citizen can have a very strong opinion on the entire county, but when you talk about the zoning ordinance, you're talking about folks that own property. And you can still have a single citizen that cares about density throughout the county, but you have individual property owners that own property, and they want to conduct business with their property as they thought they could have. Now, zoning changes, and that's really the debate that will be allowed to go forward. And all the commissioners, as far as I recall, you're an all volunteer force, and you look forward to making those decisions on the zoning ordinance. But that's what this slide's about. It's really, planning and zoning taking us through that deep look at what zoning means to the future of Calvert County. Business climate, talk about Calvert Marine Museum. I'll just say this, that I think the Calvert Marine Museum has done a great job of creating a campus for the future. There's another opportunity that's available for one additional piece of property that would really finish the campus for the long term. And we're looking at the availability of that piece of property. And if it becomes available, we'll bring that to the Board of County Commissioners as well. The Lower Oyster House, just the simple fact that many of my ancestors actually shucked oysters there many, many years ago. It's come around that building needs to be upgraded. It's historical for us, not just for my family, but for Calvert County. That is a particular project that, with the commissioner's guidance, we have identified funding that would allow for the upgrade for that building to protect it from the environment. And as you can see, we're looking to move forward on the physical upgrade to that building. Agritourism is something that was also addressed in the comprehensive plan, just to continue to improve how we utilize existing rural character of Calvert County to really allow for our farmers and our property owners to reach out or branch out and really bring. There's a huge tourism opportunity, and I think we're taking advantage of it. Our staff has done a really good job of reaching out, and whether it's farmers markets or the individual farmers are really changing their properties into something where citizens can visit. There's certainly, and I'll never say there's a lot of money in it because farmers would argue that, but it's an opportunity for folks to come in and visit the rural character, spend a little bit of money, earn a little bit of money, and I think it's a destination for folks to come into the county. This is one that guidance number 4 is really technology based, and it really revolves around cybersecurity as much as anything else. We often think of what it takes to just maintain and manage the technology services infrastructure, but that's always, the user is thinking about how do they log onto the computer, how do they get to a particular website. But what this does more than anything else is, one, it's a reorganization of the department for more efficiencies internal, but two, with authorizations from the Board of County Commissioners to really project our cybersecurity staff into the future and make sure that we're protecting ourselves as much as possible. And that continued update, we can't afford to fall behind in how we establish and then maintain that network, and that's what this slide here is about. When we talk about safety, we talk about public safety in general, and you really have to think about the big umbrella that is public safety. It's not just the 911 control center, but it's also the sheriff's office. It's also our EMS folks. It's also our fire department. It's also the interaction between DNR and Maryland State Police and other agencies as needed. This 800 megahertz unit, this project, really takes us into the future as far as our capabilities to communicate with all of those entities at the same time. It's just a huge upgrade to the system. If we talk about just EMS build out, that because we're going to paid service for EMS support, it's something that our volunteers had asked for quite a while. We're finally getting around to doing it. It's very costly. I think staff, certainly the Director Vaughn, Jackie Vaughn and her staff put a lot of work into this. The whole fire rescue committee, the volunteers in general, have been certainly advocates and catalysts for taking us into the future of this program. I think the citizens are already benefiting from it. So it's a project where I think there's a lot of I think progress being made. There's a lot of lessons being learned. And I think every day that goes by, we're going to just perfect that more and more. So you can see just the numbers here. When you talk about EMS units or individuals, 16 FTEs or full-time equivalent positions, that gives us the capability to have around-the-clock coverage. And we're still building on that, so it's not just around the clock in Solomons or in Dunkirk, but it's throughout the county. Establish and fund in-house veterinarian. That was something that was, I think, near and dear to the Board of County Commissioners when we think about if you're going to build yourself an animal hospital or an animal shelter, which is what we have. It's not a hospital, but it does provide care. And it's that more immediate care that you need when you bring in an animal, whether that's a pet or an animal that we have found out there that is in need. We were contracting veterinarians in the past. We're at the point now where we've moved forward with the hiring process, and this will give our our animal shelter, emergency care, or even daily care a real big boost. And it's actually a very cost-effective way to do this. When we talked about it in the past, we were sometimes on call and didn't have a veterinarian available. Now we'll have one, and I think it's going to be a big plus for the animal shelter. Again, this goes back to the EMS build out. I'll leave this, I won't talk too much more about it, but it really talks about the idea of making sure that we have that 24-hour, 365 around the clock coverage. We'll consolidate these as we go forward so that as the presentations come to you in the future, it'll be more precise and more direct on what we've actually accomplished to date. One of the areas that certainly I think the citizens have heard a lot and the Board of County Commissioners have discussed a lot, the idea that the Board of Education, for example, has a funding formula that really allows for proper funding for our students. The other thing that we are looking at, both at a request by the Board of County Commissioners, but also at the needs of the Sheriff's Office, is to make sure that they have an appropriate funding formula that really allows them to project their growth into the future, and it's more systematic. The other thing I would say that is not on here, but certainly the Sheriff's Office actually approached my staff in conjunction with how can we, the Board of County Commissioners, better support the Sheriff's Office, but do it in a more systematic and more efficient way. So one of the things that we're looking at is a 5-year strategic plan for the Sheriff's Office so that we don't have any surprises. I say that because that's actually above and beyond just the notion of a funding formula. So we don't know exactly what it looks like, but I will say that the Director of Finance and Budget, Tim Hayden, Deputy Sheriff, Lieutenant Colonel McDowell, have been working hand in hand with staff from both of those departments. I'm involved in it really from a knowledge base, but I think a lot of good progress is being made, and it's not something that we're looking to hammer out in a minute. We're looking to make sure that it makes sense and it's for the long haul, and it's something that can be adjusted smartly as we go forward.
County Administrator?
Yes, sir.
As you work through that particular point, you have to take into account the resources of the Maryland State Police and how they figure in to the total law enforcement commitment that's needed on a per capita basis as well as a per UCR crime basis.
Yes, sir. One of the things that, along with Lieutenant Colonel McDowell, we're looking at what, and certainly you know this, sir, you come from a law enforcement background, but I think most folks that would look at a funding formula or look at how a sheriff's office's staff don't realize the multifunctional subsections of the sheriff's office that have very specific responsibilities, their liaison and coordination with other law enforcement agencies like the Maryland State Police or DNR or other agencies as required. But we will be looking at that. We'll take a look at, what the demographics are and how that relates to the size of the force or the size to the subset. But it'll also take a look at how Maryland State Police, for example, fits into the bigger picture. And like I said, that's why we're not looking to do this in a minute. We're looking to do it over a little bit longer haul and try to get it right. This is such a huge, I think, responsibility by Director Shannon Zoll that I won't go into, and there's several slides here that I'll go through quickly, but just Parks and Recs as a general, or in general, there's so much going on. They're spread throughout the county. Oftentimes we are donated properties. Sometimes we're donated different funding sources that go to it, but it's still a huge undertaking. So not only are we looking to improve existing fields and existing lighting and existing infrastructure, whether it's bathrooms, fields themselves, or lighting to get there, we're also looking at a better way to actually bring on new fields and new opportunities for parks and recreation. Director Nizal is always looking to expand the Parks and Recs at the guidance of the Board of County Commissioners and also at the desires of our public that certainly have their opinions on and desires of what they would like to see in Calvert County as far as Parks and Recs go. So again, won't go into much detail. It's kind of consistent as we go throughout some of the additional slides. For example, 18 is a continuation of. Now, it will go through different parks. I'm not going to go through each one of them, but it'll talk about Dominion, which is down south. It'll talk about Ward Farm up north. But the general consensus is across the board, either maintenance of existing fields, improvements. When I say fields, I mean all infrastructure involved, but also when we move into those new fields or new parks, it does our citizens no justice if we don't get the park built properly, staff it properly, and then equip it properly so that we can maintain those parks going forward. The last thing we want to do is provide parks to our citizens and then they not be able to use them when we open them up the way that they were intended. 20 is another continuation of that. I mean, we could go through Hallam Point Park. There's all types of drainage, lighting, etc. So that's one of the areas when I say we're going to consolidate this. I think as we check these things off, check off these sub-goals that we've accounted for it, we'll put them in a much easier read for the citizens as we go forward as well. You got a presentation earlier on the golf course clubhouse. I won't get into details there, but great rendition. I think we're at 90%. We're moving forward. And I think we got direction that we're going to have a shovel in the ground in September, Commissioner. Is that correct?
I trust you will.
I made a note of that. Yes, sir. I mentioned this actually earlier when referring to the sheriff's office. So again, I've working with both the Board of Education and the Director of Finance and Budget, his staff. This is something that this particular year we did not use it based on the COVID-19, but that funding formula as we go forward, we have a draft already. Again, Director Tim Hayden is on top of that with the folks over in Board of Education. This is one near and dear to all of us, really, but Commissioner Hutchins, sir, this is the Veterans Commission. I'm happy to say it's got a green check on it. We're looking, we have a really good turnout for folks that we can, that we'll be selecting for that commission in the very near future. I'm looking forward to it, so it's going to help us provide advice to the Board of County Commissioners as we go forward. Sir. This is a little bit more difficult because it's the regional waste to energy facility. Again, something that Commissioner Hutchins was and remains very in tune to. Back when I had the enterprise funds as a responsibility directly, this was something that we were working on. What you have to realize to the public is that it's very costly to both haul out refuge, but it's also very costly to have to build a new landfill. So the hope you don't need to. The idea about this regional waste to energy is a way to account for our waste, maybe make some electricity out of it. Certainly your recycling, but it's also because it's a tri-county endeavor. We will, in the near future, through Public Works, be reaching out to them and then holding summits to try to get us moving in the correct direction. And to be honest, find a location for it that makes sense. The final slide here is really one of roadways, and these are, at any given time, the roads can change. We've had during our latest tropical storm where we had serious road damage, what you have to look at for road repair, like I said, can change. But these are some areas that have been underway for quite a while, various stages of completion. I think Public Works staff is on top of this, and these goals are on the way to being achieved. So very quick overview. We'll shorten it as we go forward in the near future, but any questions the commissioners have for me, I'd be more than happy to address them.
Any questions? I don't see any, but it's good to see green checks.
It is, and we could probably put a few more green checks on there, but the reality is we want to make sure that they're closed out. I give all credit to staff.
As you should.
As I should, because I guarantee you, without staff, me sitting up here as I'm lying. Staff do the work.
What's that saying? Check yourself before you wreck yourself.
I absolutely believe that I'm only as good as the staff that support me, and they do a great job. And the thing that, their coordination with one another is what also allows a lot of this to happen. Shannon can't do it without Public Works. Jennifer Moreland can't do it without other agencies weighing in. So it's really a team effort, not just by department, but when they need each other to get a lot of these jobs done. And seriously, all credit goes to them.
Absolutely.
We good to go, gentlemen?
Yes, sir.
Thank you.
Thank you. So the next item on the agenda is work session. It's an update on the Maryland General Assembly session wrap-up. Council?
Morning, Commissioners. John Norris, County Attorney.
We can do that now. That was supposed to be after this, but
I think if there's anybody that's on the line that called in for public comment 45 minutes ago, please press *9.
Oh, I'm sorry. I hadn't paid attention to that part.
*9 on your phone, and we'll identify you by the last 4 digits of your phone number. So *9 if anybody wishes to provide public comment.
There are no callers on the line.
I'm sorry.
But there were 30 on hold.
The administrator's presentation was just so riveting, I lost track of time.
Thank you, Commissioners. John Norris, County Attorney. I'm joined by Tim Hayden at the table. He's got number 1 and number 3. So there were over 2,300 bills filed in Annapolis this session. It was a little busy. I think we'll see it. We'll see more next year, I think, 'cause it's an election year. There were a number of bills that have the potential to affect Calvert County, but let's start with the 2 that the county commissioners requested. The first one that you had requested was House Bill, it ended up being House Bill 1160, to authorize the county to enter into contract for cellular towers, in initial term being at least 20 years, or up to 20 years. Jackie Vaughn is on the line with us on Teams and is able to answer any questions, but this is as the board requested. It was approved and adopted. We're waiting for governor's signature.
You're good.
Okay.
Thank you.
Second request that went up was a $26,453,345,000 general obligation bond to support Beach Elementary School upgrades to fire and rescue apparatus, the Twin Beaches Library, Stafford Road Project, St. Leonard Fire Department Rescue Squad Facility, Prince Frederick Wastewater Treatment Plant, and Solomon Septage Receiving Facility. That came out of the House at $20 million. The Senate amended it back up to match the Commissioner's request, and the Conference Committee, which included members from the House and the Senate, did approve it as you requested. So the full request is before the governor for signature.
Good deal.
Yep.
House Bill 1372, which became Chapter 55, it was passed by both chambers of the General Assembly by at least 3/5 of their members, so that is now law, Chapter 55 in the laws of Maryland 2021. It's called the Blueprint for Maryland's Future, and it revises the Kerwin Bill. Remember last year the governor vetoed the Kerwin Bill when the General Assembly came back into session. They overrode that veto, and these are amendments to bring the Kerwin Bill, I guess current is probably the best way to explain it. And Mr. Hayden's here to explain what the Kerwin Bill means to the county financially with maintenance of effort and such.
I would be happy to give an overview of that. Tim Hayden, Director of Finance and Budget. I hope I'm using the right law numbers and names, but so for fiscal year 22, our current year funding, the Kerwin Bill actually defined what our 22 maintenance of effort would be. It said that you can use the greater of your September 20th enrollment, and that's the one that tanked. That's where we went from 15.5 to 14.9. Or the 3-year average of, I believe it is 18, 19, and 20. And those numbers, 15,316 students. So they would have made MOE 132 million, which would be a $2.2 million decrease from our current year. We're at 134.7 million. MOE for 22 would be 132.4 million, a decrease of 2.2 million. You might remember when the governor's budget came out, there was a hold harmless provision, and the carrot, well, that's the hold harmless provision is the carrot, but for the county, for a $1 increase in the funding to the Board of Education, we're assured a $5.3 million hold harmless bump. The school funding's based on enrollment. Enrollment went from 15,577 students down to the 14,896. That impacts the state too, and that's why they added the hold harmless provision. For us, it's actually an increase from the state from about 92 million to 93 million, but 5 million of that 93 is the hold harmless provision. And for Calvert County Schools to get the hold harmless provision, we had to increase our funding from the prior year, regardless of the MOE decrease I referred to a minute ago. So the recommended funding is a $1 increase from last year, and we get the hold harmless money from the state. One of the concerns with doing that was that, well, if we reset MOE at that point, and in this case it was 681 students from 21 were not there. I'm sorry, 681 students that were part of the count in fiscal year 20 that weren't part of the count in fiscal year 21. The risk was that all those students would come back and that we'd have to pay per student, because that's how the school funding works. We were afraid we'd have a $6 million increase next year that the state told us we'd have to pay. House Bill 1372 changes Section 5-235 of the code, is my understanding, and that defines the fiscal year 23 maintenance of effort. There is one current unknown in that, and that's the September 30, 21 enrollment. So what's going to be enrollment in the fall? And using 15,700, which is in line with the Board of Education's estimates, a good bit higher than the Maryland Department of Planning estimate. So I consider it almost a worst case, definitely the right range. That would get us up to 135.7 million. So from 134.7 to 135.7, or a 1,060,000 increase. So that was the big bump that we were worried about. As long as enrollment comes in at a reasonable, logical a number that you could expect, we're looking at $1 million increase.
And also with that is the wealth equalized formula is deferred until 2023. So that's why we are just looking at September 30, 2021 enrollments averaged with September 30, 2019 enrollments and 2018 enrollments. They're skipping 2020 as part of this adopted legislation. Any questions on House Bill 1372?
Did you hear all that, Commissioner Hutchins?
I got it.
Okay, very good. I knew you'd ask questions earlier.
Averaging was what I was using before there.
It was. I think they stole your idea.
When I increased by 1 point something million, 1,060,000.
And I'm gonna provide a write-up of that came up this morning. I'll try to summarize that all into one page that,
Good, thank you.
And that's what it means to the county. It means more to teachers. There's things the Board of Education has to do with career ladders and other pieces of this legislation to implement. That's just what it means financially to the county. So,
All right, thank you.
next, Matt Coomers is here. I asked him to come by and discuss private well safety program. This is one that specifically affects those who are landlords and have tenants that are on properties served by well. Matt? Have a seat at the table.
Yeah, it does.
How you doing, Matt?
Very good, very good. Good afternoon, Commissioners.
How you doing? Good seeing you.
I'm very good, very good. This bill started as a much larger bill with a lot of different components. It was basically condensed down to what the sponsor specifically thought was appropriate without taking it into more study. So there's going to be more to come on this. But basically what it does is it requires the owners of residential rental property to test their water every 3 years, to notify their tenants of the water tests, and to correct deficiencies in the water quality when contamination is, that gives them 60 days to correct the issue when contamination is noticed. So they also have a responsibility to notify, the Maryland Department of the Environment as well as the Health Department that there is an issue. And the Health Department, this bill does also authorize the Health Department that they may enforce this with, civil penalties. But yeah, that's the idea right now, is to basically try to ensure that folks that are renting properties have good, clean water.
When does that go into effect?
July.
July.
Yeah, I believe it is.
I'm just wondering, how do you get the word out to some
July
of these
1.
guys around here that have, I know guys that own 50 to 100 rentals.
Yeah.
How do we get the word out to them? Because most people wouldn't even know about it.
Right, exactly. Yes, it's effective July 1. There's one issue with this that is yet to be resolved, which is exactly what water testing is. So it says you have to test your water every 3 years, but what exactly does that consist of? And the bill requires the Maryland Department of the Environment to write regulations to specify exactly what is to be required for this well testing. So to be honest with you, it's problematic without the regulations to begin to implement, because even if the landlord comes to me today and says, well, yeah, what do I need to do? I can't tell him because the regulation doesn't exist for that. So
Where does one get the test kit from?
What it is it won't be like a home test kit or anything. They'll be required to consult with either a private laboratory. There are certified water samplers that would have to collect the samples and bring them to a certified laboratory. So it's not like a home test kit type thing. This is these are certified individuals. They hire a company to do it. Yeah, it could be a significant expense.
Once every 3 years.
For every rental property?
Yeah.
Once every 3 years.
Wow.
Yeah. And so it'd be for each one served by a well. So this isn't for those served by community water, only for private wells.
And residential, as I understand, as
That's
well,
correct.
not
Residential
commercial.
as well.
And this is going to increase a lot of work on your staff too.
Potentially, they have the option to. I mean, they could hire us to do the water testing if the landlords choose to go that direction, but they don't have to. They can also hire their third party, private laboratories, which are quicker than we are.
And Matt makes a good point. We don't know whether they're testing for MTBE, heavy metals, bacteria, chlorine, parasites. A lot of work still needs to be done before July.
We were hoping that this bill wouldn't go as far as it did without having refined those elements, but they thought that this was an appropriate measure, and then more conversation, more work groups will be had to kind of refine the rest of what they wanted to do. Which
Unfortunately, that happens a lot, though.
Yeah.
You see the big headliner issue, so it sounds great.
Yeah.
But then the research and the small stuff underneath, and I know you see it on a regular basis. This is my huge frustration when you'll see a group on one part of the state, and maybe it's a good idea, but it's got consequences. Maybe it's not a good idea, but the research and the complete package sometimes doesn't always seem to go with it, and that's a great point. Hey, who doesn't want clean water, right?
Everyone does. I mean, that's
Who
what
does,
we-
right? It's in this country, clean water should be a standard, right?
Absolutely, and we agreed with the.
But what's the definition of clean water, right? So yeah, right. Is it the guy got the little test strip and said, "Oh, that's good," or was it actually safe drinking water for the people?
Right, exactly. And the original bill, as drafted in its first form, actually defined, some elements to be tested. The problem was it wasn't like it's broad. It really didn't include all of the elements that needed to be tested. But in some of the elements that they're required to be tested, such as radon, are problematic for actually testing. It was more of an issue with air quality with radon gas as opposed to water quality. It still can be found in our water, but there are EPA standards that didn't match up what was in the bill language, and so there were a lot of issues, like technical issues, that we're hoping to continue to work with the sponsors to improve. But you'll see more from this private well safety program next year, and hopefully it's more refined.
Hopefully they'll get it right.
Yeah, I know they're hoping to also provide funding for folks who low-income folks who can't replace their wells, who need well replacements, and basically provide a way to assist those folks in doing so. And I think it's a great idea. They don't have the money for it, so that was one of the reasons why this didn't happen. They couldn't find where the funding was going to come from. So we'll see. I think next year that's going to be an element that comes up again, and we'll continue to work with them to try to make good legislation here that works for folks, and they can pay for.
So whenever they start this program, I assume MDE will track the data and provide information back.
Yeah,
to
that's
the
part
counties.
of this bill, is that the MDE is required to track that data and provide the reports back to the.
'Cause we hear about arsenic all the time.
Yep.
Yeah, state legislatures. Yeah. Yep. So, there's a good deal of information on arsenic, but there's probably going to be a great deal more information gathered. That's one of the good things about this, is that the data gathered from this will actually really complete a picture of water quality much better than we even have right now. So, there are going to be good things, I think, come from this. It's just getting it right and refining that language and tuning it in to where it makes sense. And I also think you have to look at elements. One size fits all for the whole state isn't like appropriate. I mean, there are places where you really have to look for some,
Shoot, man, that's the playbook.
Yeah.
You see that? Somebody in one part of the state thinks it's great for his people, and maybe it is.
Yeah.
But then they shove it down the other jurisdiction's throat with that, oh man, that ought to be a bumper sticker, Maryland, one size fits all.
Right.
I mean, that's what drives me nuts, makes my eyes just twitch like crazy this time of year.
Yeah.
When you see some of these bonehead ideas with no research, not understanding any unintended consequences, how it's going to be paid for or anything, and they just go, boom.
Yeah.
So
one of the biggest issues in Maryland is the drastic difference in geology from the eastern shore to coastal plains,
it's night and
western
day.
shore,
It's night and day.
to the rock in the west. I mean, there's just the water sources are, they vary drastically even with private wells. So the things you have to look for are very different.
Okay.
Commissioners, one thing I'll point out, the question also included how we're going to get the information out to those that are in need of these services. So CMR, whether it's through Channel 6 or through our PIO staff, they'll make sure that we reach out to realtors, et cetera, and the citizens to get this word out.
Yeah, absolutely.
All right.
Matt,
Thank
we
you,
appreciate you coming by.
Thank you,
While
Matt.
Matt's leaving, there was another bill, House Bill 407, that dealt with septic systems. So starting July of 22, those who inspect septic systems, typically on a residential sale, will have to be certified by MDE. So they'll be licensed inspectors.
Licensing, yeah.
So the Bay Restoration Fund gives this new bill, House Bill 878, thank you, and Senate Bill 701 gives the county authority to incur indebtedness before you actually receive, or the money's there in the Bay Restoration Fund. Whether or not that's going to be a good idea, we're going to leave up to financial advisors because I don't know that it's predictable, but there is the opportunity to use debt service to prepay for public works projects that may be necessary in areas with failing septic systems. House Bill 801, public safety buildings. Mary Beth Cook is here. She's already given you a presentation on this one, but it does change the number of people who may attend an agricultural tourism event inside a building that has been repurposed, not constructed from new, but repurposed for agricultural tourism, from 50 to 200. They still have to comply with the requirements for width of egress. They have to comply with the primary use of the building having been agricultural. The egress has to meet the code or exceed the code. It's limited to ground floors, so where there's a ground level exit. Must meet the regulations established by the Department of Planning and Zoning, including adequate parking. Critical area regulations must be met, and it is subject to preservation easements like APD. This does not supersede that. So if there are covenants or restrictions on the property that are incompatible with this new bill, the property is still limited by those covenants and restrictions. Last is the early voting centers. I'm only going to tell you that it looks like Calvert must at least have one more early voting center, and they're going to be open longer. I know that the Board of Elections is working on a presentation for you, perhaps even as soon as next week, next meeting for the board. So I'll leave that one to Ms. Hatfield.
Comment on that one,
Yes, sir.
John. We need to look to have an early voting center in each of the 3 districts.
Understood. The law changed, or the law created an opportunity for the counties to, requirement for the counties to establish early voting centers based on population size. The law only requires Calvert to have one more, but that does not preclude Calvert from doing more. So that's all I have to offer.
Right. The problem is if you add one more south, the people up north are going to complain. And if you put it up north, the people down south are going to complain. So Commissioner Hutchins is right. We're almost stuck.
Just
Unless they move the one from Prince Frederick, and then you have one, and
just put one in each district, and
it's only a couple $100,000,
right?
So, there was one other bill we discussed in the memo that was not in the presentation. It's House Bill 333. That would have allowed the county to do some work in the critical areas, like repair boat ramps, to repair boardwalks. Shannon has all worked with Delegate Clark to get that bill introduced. It did not make it out of the Senate this year. So, if there are any questions, discussion?
Just one more. Council, as I mentioned earlier, would you get together all of the enrolled legislation that pertain to law enforcement this year, which there is a slew of it? And I'd like to be able to go through that and see what we're confronted with.
Absolutely.
Thank you.
Thank you.
I think we're good.
Thank you.
Thank you. So we've done that. So I guess the only thing left is Commissioner reports. Commissioner Hutchins.
Thank you, Mr. President. Just first of all, to note the passing of a classmate, Michael Smith. His father was Reno Smith. Michael was a Boy Scout, also in the same scout troop that his father, 426, was a troop scoutmaster. He lived across from where Prince Frederick Boulevard is, and he died in Frederick just at the end of last week. Secondly, I submitted a letter to the editor of the Calvert County Times. It was published this past Thursday. And I seldom have commented about the process of the comprehensive plan, which the board properly adopted in August of 2019. But that particular article required a response. And so I indicated in my letter the hundreds of citizens and organizations that were interested in learning about the comprehensive planning process and all the work that the staff did to work through that over the course of the time it was instigated in 2015 to the time that it was adopted in August of 2019. If we had not adopted that at that point, and it was at the right time to adopt, we would not be where we are with the comprehensive town center master plan and zoning ordinance plans for future land use within those town centers. We are well into that. And again, we have had lots of opportunity for people to provide input to that. And over the course of the next several years, we'll see that come to fruition in all of the town centers. So with that, I just wanted to reiterate the importance of where that comprehensive plan came from and how it was processed, and that we certainly can engage in civil discourse, and sometimes it gets rather emotional at times, but when you start to castigate staff or other members, then it's time to set the record straight. So that's my response to them. And that's it.
Thank you. Commissioner Hart?
Lost a good friend, and I consider family, Mr. Delamarter. I'm from the generation that my elders, I still have a hard time saying their first name. You know, it was always Mr. Delamarter to me, and he was always affectionately called Big Bob. And this gentleman, he personified your word meant something. A handshake meant something. He had no problem speaking out for what he felt was right and what he knew was the right thing to do. Many times I had asked him for advice and things of that, and I knew I was going to get it straight from the shoulder. You know, his family even personifies him. When you see them, they're just great quality people. He's from a generation that I think we're losing in this country where, you know, if it's the right thing, it's the right thing. And if your feelings get hurt, well, that's your fault. You know, I'm a big fan. Don't tell me what I want to hear. Tell me what I need to hear. And he always did that. I mean, he will sorely, sorely be missed by many. Just very, very few people in my life that I could say that I've known good 40 some odd years, if not more. And I can't think of one time that he ever disappointed. You know, I mean, not saying that people aren't human, but I tell you what, he, you know, his message was don't do it if you're going to do something, don't do it halfway. All the time, you know, it was all the time with him. And great man, great family man, great individual. He will sorely, sorely be missed. Don't forget, Mother's Day is around the corner. I don't know what's more important than Mom. Without Mom, none of us are here. So that's coming right around the corner, and just want to thank staff for everything this week. And that's all I got.
Thank you. Commissioner McConkey?
I have nothing this week.
Commissioner Weems?
I have nothing to report this week, sir.
Oh,
I do have one thing. Every time I say I have nothing to report,
something
I feel
pops
like
up.
I just want to congratulate the Hans family on their new addition.
Thank you.
Yes.
Oh, congratulations. I didn't know this.
Yeah.
Yes, he has a new grandson.
Your new grandson.
Congratulations.
So, yes.
Last Thursday.
Does that mean there's going to be more street signs going up?
More Hans roads. We need more Hans
Well, he's got to have his
roads.
own road. That's only right, buddy?
Yeah, it's going to be Hans Jr., Hans Senior.
Yeah.
Well, you got Hans Crossing, Hans Exit.
Right.
We can just cover the county.
I think I even
That's
saw
right.
a deer crossing that said Hans on it the other day.
Dear Hans. Is that all you have, sir?
That is, sir.
All right.
All right.
So, on a sad note, last Tuesday I attended the viewing for Deputy First Class Beisel from the Calvert County Sheriff's Department, and such a tragic thing that was. A young man served as a resource officer at Patuxent. Northern High School. I'll get through all eventually. At Northern High School, but a very young man, left a young family behind. Just very, very tragic. So our deepest sympathies go out to his family, and hope that they got some tough roads ahead of them, but hope that they do well, and it'll get better eventually. But a really tough thing. But on a better note, as I mentioned earlier, farmers markets have opened, and I heard yesterday strawberries are ready. So wherever you do your picking, you start to get in touch, because it is the season, and they are my favorite fruit. So I'm going to have to take a day off and go strawberry picking. And as Commissioner Williams mentioned, Robin and I welcomed a new grandson in last week. Dustin Hance came in at 9 pounds 4 ounces.
Wow.
Nice, healthy
Wow.
boy. Looks like a Hance. So
That's important.
he and his mother are both doing well, and so we're all very happy at the Hance household. And we're just finding another road to name.
I think he was so big because he came out riding a tractor, didn't he?
Man, they had Tiffany scared to death. They kept telling her it was going to be 10 pounds, and man, she was not looking forward to that.
That's why, back to my how important is mom.
That's right. Exactly.
Yes.
Exactly. Yeah. So we're going to have a good Mother's Day at the Hance family. So
There you go.
that's all I have. Would entertain a motion for executive session. Commissioner Williams?
Yes, sir, Mr. President. Request a motion to enter into closed session pursuant to General Provisions Articles Section 3-305B7 to obtain legal advice.
Second?
Have a motion and a second to go into executive session. Discussion on that motion. Hearing none. All those in favor say aye.
Aye.
Opposed? Motion carries 5-0. So everyone out there, have a great day.